Hannah?
Good morning. If we could have all of the council members to start their video, please.
Courtney, it says that the host has stopped my video.
Okay, we'll see if we can get that correct.
Same for me.
Courtney,
I can't start mine either, Miss Courtney. I don't know what's going
I
on.
can't either. I'm the same way. It's stopping me for some kind of.
I'm mute, but for some reason the video is not coming on.
Yeah.
Hey, don't feel bad, Julie, and both Julies. Don't
Yeah.
feel bad, because mine is not coming on, and I'm like,
Oh,
freaking
Rosalind.
out. I'm freaking. So excuse me. But to everybody, good morning.
Good morning, Rosalind.
So, well, that mean that that cause Nicole Larson just wrote that appears. Oh, it appears we may be in webinar, not a meeting, because if we're all taught by the host, then wouldn't
Hey,
that
I found my problem, so I'm gonna have to do a little adjustment
Never
to
mind.
mine.
Oh, I'm here.
And I just said that, yes, this is the webinar setup, Courtney.
Good morning, Randall Brown. How are you?
Good morning, everyone. Good morning.
Hey.
Good morning, everyone.
Good morning, Mr. Matthew Rivera.
Good morning.
Oh, good morning.
Good morning, Jill Hanna. How you been, girl?
Sorry, I'm so ugly.
Girl, you look
Oh,
good.
hey, stop being negative.
I've heard that my whole life.
I got it. Okay, cool.
How crazy.
We all think the same thing of
Look,
ourselves.
Julie, you look pretty. Julie, you look very pretty.
Video of yourself, so that's what I do. Hide self-view.
Good morning, everyone.
This morning.
Good morning.
Distract me, but I'm not vain at all. But mirrors distract me.
Hey, think of positive things, Jill, because that's what I do. I think of positive stuff.
Courtney, do we have a quorum?
If we may get all council members to start their video, please, so their faces. And I think once that occurs, then we will have a quorum, sir.
Okay.
Just bear with me. I'm getting everything together.
I don't know what the difference is, but Hannah and Nicole Larson say this is set up as a webinar as opposed to a meeting. So I don't know what the difference is, but That's in the chat. Just heads up.
Thank you.
You're
Thank you,
welcome.
Jill.
Oh, this one's heavy. Oh my God.
Okay, Courtney, is everyone's cameras activated at this point?
We have enough that they have counted for quorum. Yes, sir.
Okay. Good morning, everyone. Welcome to the winter quarterly meeting of Louisiana Developmental Disabilities Council. I'm your chairperson, Randall Brown. And so we will begin introductions. I think the easiest way to do that is for us to go by region, so that when I call your region, please tell us who you are, and I think that's the best way for us to get acquainted this morning. So I'm the chairperson. I'm from Region 7. And again, I'm Randall Brown. I want to welcome everyone here today. And so Region 1. We have anyone from Region 1?
Oh,
today?
sorry, Randall. It's okay. I'll go first. It's Jill Akeley. I'm from Region 1 and 10, and I'm a self-advocate leader for all people with intellectual developmental disabilities.
Thank you. Good morning, Jill. Region 2.
No, Region 1 and 10, Jill Hayno, self-advocate.
Thank you, Jill.
Stephen Wynn, self-advocate.
Okay.
Stephen Wynn, self-advocate.
Good morning, sir.
Good morning.
Region 3.
Kim Bazile, parent advocate, Region 3.
Good morning, Kim. Region 4.
Carmen Setnar, parent advocate from Lafayette.
And Lillian Dejean, self-advocate, also from Lafayette.
Good morning, ladies.
Good morning. I'm Matt Rivera. I'm founding member of the Community Provider Association. I also run a home and community-based service organization here based out of Lafayette. We do have offices in 6 other regions around as well.
Thank you, sir. Region 2, I called that earlier, but I think that maybe I wasn't heard. So Region 2.
Great morning. My name is Karonda Corley. I'm a parent serving as proxy today for our Region 2 council member.
Good morning and welcome. Again,
Hey,
with
good
Region
morning.
2, any other members?
Yes, good morning. My name is Michael Billings, parent advocate of children with developmental disabilities, and also a member of the Executive Council Committee.
Good morning, sir. Okay, Region 4. Any members from Region 4? Nobody from Region 4? Region 5.
Good morning. Tamisha Sonia, parent advocate, Region 5 from
Good
Overland.
morning. Region 6.
Good morning, it's Mary Tarver. I'm parent advocate for Region 6.
And Region 7. I'm from Region 7, but I know we have 2 other council members as well. So are any of you available? Region 7.
Good morning. Can you hear me?
Good morning, sir.
This is Mitch from Region 7, self-advocate, but also program director for independent living for the Center for Independent Living in North Louisiana, New Horizons Independent Living Center. Good to be with y'all this morning.
Good to see you, sir. Good morning.
Thank you.
Any other members from Region 7? Region 8. Okay, Region 9. I think we've already had our Region 9 and 10 members to speak, but I'll call again Region 9. And Region 10.
Yes, good morning, everybody. My name is Rosalind Marie Heimel. I am a self-advocacy person from Region 10.
Good morning. Okay, and so for our department representative members, I don't have the list of those, but would anyone like to introduce themselves from the department membership?
Excuse me for a second, Randall. Can I
Yes.
go and get something out of the day room for a second real quick?
Yes.
Thank you.
Now, again, our department members, if someone would like to start.
Morning, everyone. My name is Michelle Guillory. I'm with the Governor's Office of Elderly Affairs.
Thank you, Michelle. Good morning.
Good morning.
morning.
This is Julie Foster Hagan with the Office for Citizens with Developmental Disabilities.
Good morning, Julie.
Hi, everybody. This is Jen Katzman with Medicaid.
Morning, Jen.
Morning, I'm Melissa Baham from Louisiana Rehabilitation Services.
Good morning, Melissa.
Morning.
Sarah Fletcher from LDOE.
Good morning, Tara.
Bambi Palazzolo, Governor's Office of Disability Affairs.
Good morning, Bambi. Is that everyone from our department membership that has spoken? Okay. All right. So now I'd like to go over the mission statement and our ground rules for today. Courtney, could we post those so everyone can see them on the screen?
Half of the time when you put stuff on my on the board, it knocks my camera straight out. So I had to come back. So just excuse me, Randall.
That's okay, Rosalind. Thank you. So this is the mission statement for our council, and it is to increase independence, self-determination, productivity, integration, and inclusion for all Louisianans with developmental disabilities by engaging in advocacy, capacity building, and systems change. Our teleconference meeting protocols, as you see listed before you, are that the council meeting shall be accessible via Zoom and live streamed on YouTube. Council or committee members will participate via Zoom and you'll be considered present when you display a live feed video of your face with your first and last name. Have microphones muted unless called upon by the chairperson. Electronically raise their hand to request the chair recognize them to speak. Once recognized to speak by the chair, their microphone shall be turned on. After speaking, the microphone shall be returned to mute. Guests may participate via Zoom or observe meetings live on YouTube. All public meetings shall be recorded and may be made available on the council's YouTube channel as determined appropriate by the chairperson. Public comments submitted during a meeting via any format I'm sorry, I lost the place when the screen moved. I was reading off the screen. All right, public comment submitted during a meeting via any format below shall be considered. During a Zoom meeting, guests may electronically raise their hand to request to comment. Upon being recognized to speak by the chair, the microphone should be turned on. After speaking, the microphone shall be returned to mute. Post comments relevant to the item under consideration in the chat box. Post comments during the live stream of the meeting on the council's YouTube channel, and the link is listed there below. Public comments of a person's character will not be heard. If the comment continues after being asked to stop by the chairperson, council staff may be instructed to end the meeting. The chairperson will notify the executive committee of the occurrence. Council chair will seek guidance to determine if it is legally appropriate to redact or share the video of the meeting on the council's social media. Okay, and so those are the rules, and I would like to remind any proxy members today that when we get to issues that require a vote, you will not be able to vote on any matter that is put to a vote today, but you will have voice throughout the meeting and can participate in debate. But when we get to issues that require a vote, only members appointed by the governor are allowed to cast a vote. All right, having said all of that, we have our October 2020 meeting summary. And we need an approval for that. Was sent to you in your packets, and so I hope everyone had a chance to review that. Do I have a motion to approve the October 2020 meeting summary?
I approve, Randall Brown.
A second.
Thank you, Jim.
A second, Randall. This is Mitch.
Thank you, Mitch. So I have a motion by Joe Eagley and a second by Mitchell Edens. Do you have any objection? Any abstention? Hearing none, the motion carries. Thank you. And so my chairperson's report is rather light. We have a lot of business to get to today, and we're already a little bit behind schedule. So I did attend 2 meetings on the Executive Director Search Committee that were both rather lengthy last quarter. And I'll give report on exactly what transpired there in just a moment. But I wanted to let you know that I did do that, and I did also have a meeting along with Courtney and Brenton with the School Board Association. So with regard to cameras in the classroom, bill collaboration, and some other issues related to it. So those were the main 3 meetings I participated in this past quarter. And that's really all I have for you in terms of chairperson's report. Brenton, would you like to go ahead and give the stats on the Executive Director Search Committee now, if you have those?
I don't have it available. You'll have to give me a minute to go find that report.
Okay. We can move that along. Courtney, would you like, I know you have several things to get to. Would you like to go ahead and begin your report?
Hi, good morning. So you're wanting me to go ahead and do the executive director's report, and we're going to bypass the other agenda items. I just want to make sure I'm understanding correctly.
Well, I was just trying to give Brenton time to get the report available. Did we have any executive committee recommendations? I know we had it's a rather lengthy discussion because we need to talk about the legislative agenda, correct?
There are many things that we need to discuss.
Right.
Correct. I'm asking, you want me to go ahead and just get a director's
I'd like you to give
report?
your report first before we get into all of the executive committee recommendations, if you would, please.
Sure. Let's see if I can share my screen. So thank you everyone for joining us this morning. Again, I'm Courtney Rowland. I'm the interim director for the council. So since October 1st, there have been quite a few changes. Most notably, the county, we are no longer downtown on Main Street. We are now located at 5615 Corporate Boulevard, Suite 500B, which is still in Baton Rouge. And may say that moving an office was a Herculean feat. I don't know if anyone else has had to encounter that before, but that was not an easy task. I can speak on the federal reporting. Typically, our federal reporting is due by January 1st or December 31st. But because the Administration for Community Living no longer has a contract for the company who does the data collection from all councils on developmental disabilities, they had to delay or extend that reporting deadline. So we were notified on November 25th that the extension has been moved from January 1st to March 31st. And again, that's provided if they have a data collection mechanism in place by that time. If they don't, I imagine we will be issued another extension. I participated in a regional engagement call with the Office on Intellectual and Developmental Disabilities and the Administration on Community Living. This only occurred with certain executive directors from councils in 2 regions of the nation, and Louisiana is a part of Region 4. And they wanted to discuss things that were going on regarding COVID-19 pandemic and emerging trends regarding mainly regarding telehealth and how it was being implemented. And I would like to actually thank Ms. Julie Foster Hagen. I had asked her some questions before that meeting was conducted, and she provided a lot of great information for me. So thank you for that. The NACDD, National Association for Councils on Developmental Disabilities, conducted their Executive Directors Leadership Summit. That's typically done in person and over multiple days. However, due to our new climate, it was conducted virtually on December 7th. And that was my first chance to get to speak with all executive directors from all states, all states with councils on developmental disabilities. We ended up doing multiple breakout sessions, and I think they had encouraged some of the others wanting to do this again, since it was in a virtual format. So there may be another Executive Director Summit in the near future. Some of the collaborative efforts that I've participated in has been with Disabilities Network, which includes Disability Rights Louisiana and LSU Human Development Center. So we've been following LDH's response to COVID-19, particularly with data on individuals with developmental disabilities and their participation in adult day programs. And LDH is also full with providing data for us regarding that effort. But there's still some monitoring that needs to be conducted. The DD network will still continue to make recommendations along the end. We've had a meeting with Senator Franklin Foyle, who was very enthusiastic and motivated to his work on the cameras bill, which is on our legislative advocacy agenda. He did ask that the council assist with 2 items: assistance with getting testimonies regarding this aspect, which I believe our LaCan leaders have already begun collecting that, searching for that. And then the other item he requested was assistance with contacting and getting collaboration with the Louisiana school, if not to get their support on this matter, to possibly provide input that could help with getting this bill approved. And we did eventually conduct a meeting with the executive director of the School Board Association. And so they have asked for some data from us or from the public before they have committed to supporting the bill for the cameras in special education classrooms. So there's still some work to be done on that aspect as well. The Emergency Management Disability and Aging Coalition is still continues to meet and providing resources and updates regarding FEMA assistance and the COVID-19 vaccination rollout. They also reported that they were developing a crisis counseling program for individuals that were affected by the many hurricanes that impacted Louisiana and by the coronavirus. And as far as I have been made aware of, there have been only 3 council members who participated in other meetings that were associated with the council during this past quarter. So I would like to thank Ms. Lillian Dejon, Ms. Jill Eakley, and Mr. Stephen Wynn for participating in the National Association for Councils with Mental Disability Self-Advocacy Discussion Series, which actually they have another meeting scheduled for this afternoon. So I've encouraged them that if our meeting happens to end before that meeting begins, to continue to participate in that series of webinars. Ms. Marilee Andrews on staff has also participated in some meetings representing the DD Council, and I thank her for those efforts. She is a member of the Louisiana State Interagency Coordinating Council, and she's also represented the DD Council on the Office for Citizens with Developmental Disabilities Services Visuals Work Group, which kind of goes along with one of our initiatives on videos and visual materials. So that's very relevant to what we're doing. So I figured that Marilee was absolutely the most appropriate person to be on that work group. And then she is also our representative on the ABLE Account Advisor Achieving a Better Life Experience Council. And you can see the update that she's given there. He has been participating in the Officers with Developmental Disabilities Stakeholders Group. And I think all of you know that there have, or I hope all of you know, there have been some DXK, and we've been trying to get that information out for you guys. And I know some an LADDC went out regarding that as well. Mr. Andrus has also assisted with Office for Citizens with Developmental Disabilities and Louisiana Department of Health with trying to get some information regarding our legislative advocacy agenda item on the direct support professional wage increase. That's taken multiple meetings. He also participated in the meetings with Senator Franklin Foyle and has served on the Governor's Advisory Council on Disability Affairs Legislative Committee. Excuse me, sorry about that. And then you can see the actual listing of meetings that I have attended since October 1st. And
wow,
towards the end, there are a lot of meetings with Louisiana
Wow, that's a
Department
lot
of Health and Fiscal. And when we discuss our budget report, you will understand why there are so many meetings with Louisiana Department of Health, Budget and Fiscal. So does anyone have any questions from the Executive Director's report? Ms. Hayno, I see your hand raised.
Ms. Hayno, you have the floor.
Are there more of these self-advocacy webinar? The discussion series, isn't that ongoing? And if so, how can I sign up?
So I've been sending out, since it's a self-advocacy discussion series, I've been sending those invitations out to all of our self-advocate council members every time I receive those invitations.
Okay.
So if you have not been receiving invitations, then
all right, thank you.
Miss Courtney, I have a question.
No
Let
problem.
me unmute myself. Okay, so the legislative session this fiscal new year 2021 through LaCan and LaTeach, is it going to be virtual? Because mine's are Hifferty and Harris. Representative Hifferty and Harris, how is that going to be processed?
Okay. So just for clarification, we no longer have LaTeach. That kind of merged with LaCan.
Oh,
I didn't know if you were aware of that. So if Miss Ebony Haven is on, she can actually speak regarding what LaCan has planned for legislative visits.
Yeah, because I'll do anything virtual, roundtables or anything, just to, to share the message and how they can implement, to help people with IDD. Because let me ask you, for me being on the DD Council, if I had an idea of passing a law with the Senate and the House side in Baton Rouge for dealing with disabilities like transportation, is that appropriate to do? Because I know that transportation is a weak department for IDD because sometimes they can't even get around.
Correct. And actually, housing and transportation have both been hot topic items for this council. Unfortunately, though, transportation is not on our current 5-year plan or the upcoming 5-year plan.
Okay.
And but thank you for that, for addressing that and recognizing that it is a need.
Yes, thank you, Ms. Courtney Riley.
Okay.
You have 3 other council members with their hands raised.
Okay. Who are they?
Ms. Karonda Corley, and Rosalind Hemel, and Matthew Rivera.
Okay, they can go in that order. Ms. Corley, you have the floor.
Great morning, Mr. Chairman and Council, and I thank you for the opportunity to ask a question. First, I would like it if someone on the council can actually answer the question that Ms. Kathy Dower have in the chat which is in regards to the people in the DD community, the data with them as it correlates to COVID-19. Can someone answer that? And then I have a follow-up question after that. But I greatly appreciate if someone can answer that question first, and I'll read it into record for you. It says, when the DDC, HDC, and DRLA discuss COVID testing, did you also discuss data collections of the DD community and how many have had COVID as well as passed away from COVID? There is national data that suggests the DD community has the highest death rate from COVID. And I would greatly appreciate if someone can answer that question first. And I have a follow-up question after that.
Can I please share my tidbit of?
Hold on, Courtney, do we have the data on to answer Ms. Dwyer's question?
Actually, I was wondering if Mr. Chris Rodriguez could speak to that. We do have some data. I don't have it currently pulled up to be able to share off right now, but Mr. Rodriguez has been instrumental in helping collect that data as well.
Okay, Chris, could you speak to that question for Mr. Dwyer? Please, sir.
Yeah, I'm sure Julie can probably chime in as well, but it's been a priority, I think, of DRLA's in conjunction with our DD network, which is the USAID, the developmental center, and with the DD Council to kind of monitor these things. And this has been going on for months. We actually contacted LDH and requested that information when it wasn't being provided, and we had a good conversation with LDH leadership, which resulted in I think the weekly production of a report that provided the public with several data points, including the number of individuals within ICFs and that are receiving HCBS waivers, the DD waivers, who have tested positive, who have been hospitalized, and who have unfortunately passed away as a result of COVID. And those were being placed on the LDH OCDD website. And you can go there and actually look at those numbers. And in fact, what we were doing as a team, as kind of a team project of the DD network, because we try and work together, is we were actually charting that data. But it was difficult to do because of it's just the data was not in such that the numbers were super, super reliable. So we actually had a follow-up conversation with LDH that Courtney had mentioned to try and better understand the numbers that we were being provided. Unfortunately, and I think, and Julie can talk to this, I think they're in the process of maybe remedying this. They have not produced that report since we actually had that conversation. So we started to chart the data and look at it because we really wanted to present it back to LDH and ask, some questions and understand what was going on and see if there's trends and things, see if things are getting worse, if things are getting better, if they kind of mimic the general public, if they don't, because we were seeing those exact same reports saying that COVID is especially detrimental to people with developmental disabilities. So we were digging into all that. But unfortunately, since October 15th, which is, I guess, quite a few months ago, the department has not released any of those numbers. So I'm not sure where things stand.
Thank you so much, Mr. Rodriguez, for your statement. So you said all that to say that as of right now, LDH still don't have a breakdown according to persons with disabilities that have contacted COVID and that have died directly from COVID listed on LDH website. Is that my understanding?
I would confirm that with Julie, but I'm looking at the website and it says the weekly OCDD status report on coronavirus, and it's dated October 15, 2020. I don't know. Julie, you had mentioned trying to get the report up and going, I think, before we left for the holiday.
Yeah, and I'm trying to follow up with my folks on what may be wrong with the website or if they put it somewhere else, because my understanding is that we had been publishing that again. So I am going to follow up with my folks. What we were we've continued to track the information that Chris mentioned, number of positive cases of people who, it's not the entire IDD community, it is the people who receive home and community-based waiver services, and it is people who reside in intermediate care facilities. And so we do have the number of people broken out by ICFDD and by waiver services who have tested positive. And there's a process we have to go through to try to connect the OPH testing database with those members. And so they have to do sort of a bump. And that's what Chris was saying. Some of the information, we can't use that just to say a specific positivity rating in the way that they are able to give other positivity ratings, because they can do a direct match. We did this many tests, this many people came positive, or this many people negative. Because we're doing a matching and it's not all able to be in the same database, we have to be careful about how we use the data. But we have been continuing to receive the information. It looks at the number of people positive, and then we compare it in a different database, a hospitalization database. We do a bump there to find out how many people, again, in waivers or in ICFs or in hospitals with a diagnosis of COVID or COVID related. And then there's another database that we have to do a bump with, that is the OPH, the death registry. And so sometimes there's a delay because there's, we have to wait until the death is filed. But then they do a bump against that database as well, so that we can then do reporting on those numbers. And we are continuing to watch it. We know that there was a lot of concerns with the reopening of some of our adult day centers. So we've also been working with OPH to try to see if we can get numbers specific to the ADC programs. And we think that we have that worked out. I know that wasn't published yet because we wanted to make sure that it was reliable. But what we do is that as we see new cases for people in ICFDDs, our office reaches out to that ICF to ask if they need testing, because there's a certain protocol that should be followed for testing. We now have a resource through Orion Laboratories that will work directly with the ICF providers to get testing of all the residents and staff on a regular basis, regardless of if they're symptomatic or asymptomatic. You continue to look at that data and analyze that data on a weekly basis. But I will definitely follow up, and I apologize because I know that I continue to receive reports every week. I know that we were trying to modify our definitions so that it was clear where the data was coming from and what the data represented. And I thought that had started to get published again on a weekly basis. So I will definitely follow up to make sure we can get that back on our website as soon as possible.
And thank you so much, Miss Julie Foster Hagan. Because my next question is, because I want to make sure that I'm clarifying this for the public, because y'all both said a whole lot of stuff, but I want to make sure I break it down in simple terms, simple layman's terms. So basically, what you just said is that that the information is still not available for the public, broken down according to persons with disabilities. That's in layman's terms. It's still not that information according to persons with disabilities. COVID-19 data is not provided on LDH website.
It is, but it has not been updated since October. So I need to get the most updated information added back on there. It is a weekly report that we distribute that shows for the disability community of people who are in IDD, home and community-based waivers, and ICFDD facilities each week. The number of total number of cases, the number of hospitalizations, and the number of deaths. Is that clearer?
Okay, so persons that do not have waivers, but that may be a part of the DD community, they necessarily will not be reflected in that data?
That's correct.
Okay, and so how can we go about ensuring that we have a real, true, accurate account of all persons in the DD community being reflected in the data for COVID-19? Because if we're not reflecting all of them, then that means that our data is not accurate or reliable. And so I just want to make sure that we're putting out accurate and reliable information to the public as it relates to a worldwide pandemic that's affecting our DD community. So can you please tell me how can we ensure that we have real, accurate, and reliable information? And I'm quite sure our healthcare professionals will love that question answered.
Yeah, and we've worked with the Office of Public Health here in Louisiana, and we've not been able to determine a way that we can reflect that. I also sit on a national work group with other state DD directors. And I do know that nationally, this is something that they've just, we've not been able to have a really, as you say, reliable and effective method of ensuring, of pulling out certain populations in a lot of the data. I can continue to take that back as a request, but in terms of having that information for the entire disability community, I don't know that we've been able to, I mean, I know we have not been able to figure out a way to represent that other than, you know, those folks that are in waiver and ICF facilities, because then we have certain identifying information that we can use to bump against that, the testing information and the hospital information. We don't have that for the entire disability community because it would take then trying to match those people with those different databases.
All right, everyone, I have a point of order from Ms. Palazola, and we also have 2 questions that I don't believe are related exactly to this topic, although they might be from other members. And so since we've had a rather lengthy discussion at this point and good information shared, but since we've had a rather lengthy discussion on this particular question from Ms. Corley, I need to allow time for the other 2 people to have their questions or concerns addressed as it relates to Courtney's report. So Hannah, who was our other person?
Miss Rosalind Hemel and then Mr. Matthew Rivera.
I'm sorry, I didn't quite hear you.
Miss Rosalind Hemel and Mr. Matthew Rivera.
Okay, Rosalind, you have the floor.
Thank you, Mr. Chairman. Well, for me, what I want to find out in that, to me, it brought up to my attention in that for this week. Does that mean for the COVID in that, did anybody got their shots for the COVID and that, because I had mine Tuesday and I can't even feel the difference. So for the off of like page 1 in there, and you mentioned about the COVID. Does the shot come into that, like a COVID vaccine could fall in that?
I'm not sure what your question is referring to. You're wanting information on the vaccine rollout?
It's like for the OIDD, for that kind of protocol or something. I don't know if I'm saying it right.
So with the Office on Intellectual and Developmental Disabilities, I participated in a phone call with other executive directors from different regions, Regions 4 and Region 6 within the nation. And so we were just discussing what our states were doing as far as the main point was they wanted to know about telehealth, which is doing virtual appointments with. So we did not discuss the vaccine rollout at that time. But they had also brought up how to possibly address those who were resistant to wanting to receive the vaccine.
Because that's what's making me ask that, did they ever really mention it, with the vaccine or not? Because to me, down here where I'm at, they discussed it and all. And in the report, like you were saying with the, with that, I'm like, okay, did y'all ever, discuss that part? So that's what made me, ask that question, if they, if they ever spoke about it.
So like I said, we did discuss it minimally, but it was basically about accessing telehealth and addressing those who would be resistant to wanting to receive the vaccine.
Well, did anybody ever brought that up to like any other cities or parishes? Kind of, had,
How you feeling?
Discussed it, like in Lafayette or, other Hammond or, if they
Rosalind,
discussed it. Who's speaking?
Rosalind, this is Chris. So this is Chris. I can
okay, I see.
try to answer that question. So there is a group that I think several probably people on this video conference call sit on in New Orleans specifically. I think it's called Equity and Equality Vaccine Distribution Group or something like that, where we have conversations.
Yeah,
on
that's where I want to go with.
About making sure that different underrepresented populations are having access to the vaccine and are being provided education and information so that they feel comfortable getting the vaccine. And that group is monitoring as best they can kind of the percentages of different types of groups that are actually choosing to get the vaccine and the number that are declining. In terms of people with disabilities, one of the things that we're doing, and we're probably going to introduce the letter to the DD Council and with the Human Development Center, because we're trying to do a lot of this COVID stuff together at the DD Network. But we're going to put a letter into the department here probably within the next day or two, requesting all the information, and it seems like Julie already has those reports coming out, related to positivity rates of people with developmental disabilities, and that's really going to be the folks in the ICS and the folks on the waivers, their hospitalization rates, and the death rates. In addition to that, we're going to be asking the department for information on how many of those individuals residing in ICS and on waivers have received the vaccine. Because I think you might have been asking a little bit about that question, how many people with developmental disabilities are getting the vaccine. I think in order to make policy decisions like, opening up the DAHAB programs could be it could be a benefit if we know how many of the individuals that are likely to take advantage of those DAHAB programs have actually gotten the vaccine and how many have not gotten the vaccine. So hopefully we're going to be able to get that information. So ideally we would get a report back that says, 100% of the ICS have now been contacted and have the opportunity to get 100% of their residents vaccinated. We know that of the 4,500 people residing in ICS, I don't know, at this point, 1,000 people have been, vaccinated or something like that. We're looking for that information. I don't know if LDH will be able to produce it or if they're tracking it, but we're certainly going to ask for it so we can figure out how many people are actually with developmental disabilities in those two different types of settings, HCBS and ICS, have received the vaccine.
Okay, thank you.
I feel like, I feel like I'm the first one out of, everybody here on the council as, got it, the vaccine. I thought I was just the first guinea pig. That's why I was really asking.
Thank you for your question, Rosalind. And we need to move to our next question from Mr. Rivera. Matt, you have the floor, sir.
Thank you, Randall. I appreciate you acknowledging me. And along the point, and this question is for Courtney, as I mentioned, we have clients in 38 parishes, and one, we're just extremely grateful that our workers, direct service workers, and our clients have been included in the rollout in 1B. So just to give you guys a situational awareness of what's going on in the ground, vaccine is extremely limited, the availability. I would say our greatest success right now has only been in Region 4. In the other regions, we have not had very much success on getting our workers and our clients vaccinated just because of availability. Of course, we're very hopeful that that will roll out. There was a little bit of confusion out there is if our clients are eligible, but the department has issued a memo, and that memo has proven very successful in that case. But this goes to the question for Courtney. And the department sent out a survey yesterday, but you're right. Of our direct service workers, we're only seeing about a 21% willingness to take the vaccination with our workers. With our supportive independent living clients, it is way higher in the 80% range. Our clients are willing to take it voluntarily, and they are getting it. So this is my question for Courtney. Is there anything out there in your discussions with the more national group that would, maybe a video perhaps, or any documentation that you could share at any time that would help us encourage our workers to take the vaccination? Obviously, this is so important in keeping our clients safe. So that's it. Just keep your, my question is just keep it, your antennas up for anything that we could use to help encourage our workers to take the vaccine. So thank you.
Thank you, sir. Any other questions with regard to Courtney's report, specifically with regard to Courtney's information in her report? Because a lot of what we're sharing today, all those great information, and I'm glad we're getting it out there. A lot of this can be covered, as Bambi noted in her point of order, in our reports for each department later today. So with specific regard to Courtney's report, are there any questions of Courtney?
You have Miss Jill Eagley, Jill Hayno, and Bambi Polizzola all have their hands raised.
Yeah, y'all were talking about something, but I'm a warrior and I'm a little lost and confused. So let me ask you, when it's dealing with DAHAB services from the Office of Citizens of IDD, they get Medicaid or services through the ARCA GNO or any, why do a lot of the IDD folks that return to DAHAB centers, or if they do virtual, why do they have to get vaccine? Is it the government, state law? I'm just a little worried right now.
Do you want me to answer that, Courtney?
Miss Julie, I'm just losing my mind on a high mode. Can you redirect me and explain to me first, if you don't mind?
Sure. So anyone that would go to anyone who's in what we sometimes call congregate facilities, which just means they're going to be around a large group of people, or who are live in a situation where there are people who kind of come in and out, so that it's hard to just be home and isolate like others might do, are considered higher risk. And so because they're higher risk, we are giving them the opportunity to have vaccinations in one of our early phases. It's not required or mandated for anyone. We just tried to make sure that because some of our folks that receive those services or go to those facilities are at higher risk, that if they wanted to get the vaccine, they had the opportunity to get it early on. And so, but it's not mandatory at this point.
I wouldn't be classified high risk. I mean, I can easily get it before March or April. It's a matter of when it's available through Lakeview Terrace through Ochsner. My mom would just have to call in next month. Or do I have to go on your website to see when I can actually go and call?
No, if you're with Ochsner, then I would encourage anyone who's with Ochsner, I would encourage to sign up through their MyChart program. And they've gotten a lot of recognition for doing a great job trying to get folks that vaccine. So if you're with Ochsner, I'd work with your mom to go through MyChart to get on the list.
Thank you, Ms. Julie.
Okay, great information. Good question. Thank you, Jill. Thank you, Julie. But I want to remind everyone, the questions we're asking for now would be the questions specifically related to information in Courtney's executive director report now. And so if your question is not related to her report, I'd ask you to hold it until the reports for later today from each of the departments, who I'm sure will address a lot of these questions later in their reports to us. And so there will be opportunities for more questions, but as it relates to Courtney's report is what we're discussing now. And so before I call on the next person to speak, I want to remind everyone, we're having great discussion and that's a good thing, but please wait on me to acknowledge you before you speak. That it helps with less confusion for everyone if I give you the floor before you speak. So just to remind everyone of that. And we're have to be mindful of time as well. We have a lot to cover today. And so having said all that, Hannah, who would be next in line for questions?
We have Miss Bambi Polazola and Miss Jill Hano.
Okay, Bambi, you have the floor.
I think Jill was before me.
Pardon?
Jill had her hand raised before me.
Okay, I'm sorry, thank you. Jill, you have the floor.
Thank you, and thank you, Bambi. But actually, I don't even know if this is appropriate anymore, but I had a question about Courtney's report and if it's
It's extremely, it's time for her report. So your question is you may ask it, yes.
And if it's out of order and needs to be deferred, because this topic is confusing to me. But I see, and Julie, on November 13th, Courtney met with OCDD and stakeholders regarding comments from, and if you're on here and I get your name wrong, I'm sorry, but regarding concerns from Mr. Luzak. And again, defer me if y'all need to, but can we have more perspective on what was anything resolved? That's about psychological testing, correct? No.
I believe the letter of concerns from Mr. Anthony Lugzak had a lot of concerns regarding a lot of services. I don't know if Ms. Foster Hagen's report later today will contain information from that. Ms. Hagen, can you shake your head if it will contain information regarding that meeting? That way we can continue with this point on the agenda.
I didn't have it in my report, but I can cover it when I speak then.
Okay. And Ms. Mary, is this also something from you as well?
Miss Mary Tarver?
Yeah, because wasn't it deferred to education and employment committee?
I believe it actually came from the Act 378 subcommittee.
Oh, okay. Well, then I'll wait for Julie later today. Thank you for your time.
Thank you, ma'am.
Thank you. Bambi, you have the floor.
Hi, I wrote it in the comment, but I want to see if we needed a motion so we can limit the time for comments. I put the 3 minutes total, and that's for all. It seems like we're having discussion and not just comments about the topic, and we really need to move forward.
Right, we don't need a motion, but thank you for bringing up that point, and we'll be sure to keep better time on that 3-minute limit. Thank you. The rule is 3 minutes per comment per person. 1 comment per person per issue. Okay. So are there any other questions with relation to Courtney's executive director report? Anything to ask of Courtney? Hearing none. Courtney, do you have anything else you would like to add?
No, sir, that was all that was in my executive director report.
Okay, and before we move forward, I'll go back to Brenton. Do we have the information for the executive director search available now?
Yes. So just a brief update. The job description was posted in November. The announcement was pushed out both locally, regionally, and nationally. It closed on January 7th with a total of 80 applications. 61 people were from Louisiana, 19 people are from out of state. We had a total of 13 other states that had, or applications from 13 other states. 25 of the applications from Louisiana came from here in the Baton Rouge area. And Llano basically is looking or vetted to get to the top 15 candidates. Originally, they were going to do the top 12, but they have 15 that they want the search committee to consider. And so a third of those are going to be from out of state. And there's a good number of applicants that have experience specific to the developmental disability population, but there's also other experiences there for the committee to consider. Going forward, I believe the committee is going to meet again February 4th from 1 to 3. It should be on our website. And that's going to, basically all the meetings from henceforth are going to be them discussing the applicants or actually conducting any sort of interviews. But they're going to be getting, I think at the last meeting, or maybe it was 2 meetings ago, they developed a rubric of how they're going to go through these top 15 candidates. These candidates are going to have to submit a video, sort of get to know you video that the search committee is going to be able to review along with their resumes and applications, and use that rubric to kind of narrow down who their top 6 will be. And then that's what will be discussed at the February 4th meeting. They're going to kind of look at the results of all the work that the committee is going to be doing between now and that date, and kind of run through those that are on the top 6, and then get into discussions about moving forward to interviews for those top 6. Assuming everything goes as planned and the committee can still keep up with the work that needs to be done, they do anticipate by that April timeframe, we should have it narrowed down to the top 2 or 3 for the council to consider. And that's it.
Okay, thank you, sir. Good synopsis of our work. Are there any questions of me or Brenton?
Ms. Jill Hano has her hand raised.
Yes, Jill.
February 4th, y'all are gonna pick the top 12, 15.
I believe they have 15 for us to consider. We initially asked for 12, but the group has asked us to consider 15. I believe Brenton just said.
15, okay.
And that will be on February 4th.
Thank you.
Thank you. Any other questions of me or of Brenton with regard to the executive director search?
Ms. Karonda Corley has her hand raised.
Yes, Ms. Corley, you have the floor.
Thank you, Mr. Chairman. I just have two questions. Will the public, will the whole entire process be completely transparent for the public and have public involvement for the entire duration? And number two is, will the 15 candidates' information be provided along with whether they're diverse and inclusive?
Yes, the entire process will be as transparent as we can make it. Obviously, there are HR constraints on some of the process, and so we'll meet an executive session in those situations, but as much as we can make public will be made public. Absolutely, yes.
Excuse me, Randall.
Any other questions? Yes, Rosalind.
Can you fill me in, because I was trying to get back and everything. I couldn't get back in a meeting because my Wi-Fi kind of kicked me out.
Okay. Well, we've been discussing, Brenton gave us an update on the executive director search. And so our next meeting is February the 4th. And so we've been discussing questions related to that search. Any other questions with regard
Do
to
you know what?
the report?
Do you know what time on February 4th?
Brenton, what time is that scheduled for? I forget.
The meeting is going to be from 1 to 3. You will have to discuss specific matters about the application, so I'm anticipating an executive session.
Hello?
Yes.
But you do have Dr. McKee's hand up. She's had her hand up for quite a minute.
Okay, you have the floor.
Thank you, Mr. Chair, for being acknowledged. I just want the public to not leave with the impression that the interview process for the executive director search will be made public. So we need to be clear to get some guidance from HR, because again, these individuals are not considered public members, and therefore a lot of their information may be protected by human resources laws and all of those things. And so I don't want the public to leave to think that we will be conducting interviews publicly. So that's to that point. The second issue as it relates to diversity and inclusion, the Executive Director Search Committee is working closely with Lano to ensure that candidates of all backgrounds, ethnicities, will be considered for the position as well. So I just want to bring clarification to that. And that's the only point I wanted to make. Thanks for your time.
Thank you, Madam Vice Chair, for making that clarification. And as I said, and as you more eloquently stated, thank you. What information that we can legally share of the process, we will be sharing. Of course, we work closely with Lano and with all involved to make sure we follow the rules with respect to HR and concerns that would be related to protecting their information that should not be public, because they are not public figures. But in terms of the data, what we can release, we are committed to release, yes. And thank you for making that point clear. Okay, and so are there any other questions with regard to the Executive Director Search Report? Hearing none. Let's see. I think the next thing that we need to do would be to discuss the Executive Committee recommendations. And so I'll begin that process. And Brenton, again, you can help me speak to this. I think you have the data, but our need clarification on the data for what we need in terms of is it the direct service professional rate that we had a question about in terms of whether that should be a base rate, increase of $2 or for the whole, as I understand it. As we understand, because the executive committee was talking about this issue. I know y'all needed clarity, and so the executive committee unanimously thought that this should be considered by the whole council today. And so the issue is, it's a $2 increase for direct service professionals. And do we want that to be to the base pay or to everyone? And do we want that to be for OCDD and aging adult services, or one or the other was the question. And so I think you have the information that you, or the question you can clarify better because you know what you need. So could you speak to that, please, Brenton?
Yeah, so just a couple of things that were mentioned yesterday in the executive committee meeting. One is that when we reached out to get data as far as the cost for a DSP wage increase, there's really not a mechanism to determine how much it would cost to give every direct support professional a $2 bump. And so the recommendation was to go at a base rate pay. So when you come in as a direct support provider or worker, you would get a $2 increase, which would essentially be above whatever the current minimum wage is. And so that would have to be, well, you'd have to have the funding for it. And then also we'd have to work with the department to get that updated in the rule that would be the base pay. So the recommendation would be, if you keep this advocacy item as it is, that the clarity be added that it's for the base pay, because we do not have a way to make sure everybody gets $2 an hour. And we don't even know what that would cost. There's not a mechanism for us to figure that out. Also, we needed some clarification on if you wanted to look at just OCDD or if you wanted to look at just OAAS. So OCDD would be Office for Citizens with Developmental Disabilities. OAAS is Office of Aging and Adult Services. So when we got the department to run the data for us, if you want to give that base pay increase for DSPs that are through OCDD, you'd be looking at roughly a $75 million all-in number. That would equate to about $24 million in state general funds. If you want to add in the OAS side, you would be looking at an additional $65 million total, or $21 million state general fund. So for that one ask, if you do the two, you're looking at a $45 million request for next year. And one of the things to consider, like we had mentioned, the council didn't really make it clear if, we were going for OCDD and OAS, or if we were just doing one or the other. There are some concerns that if you go with just OCDD, the disparity there as far as not being equitable across the board, I guess is what I'm trying to say. So as staff, that's kind of where we need guidance from the council. Exactly what is your intent with this advocacy agenda? We just want to make sure you had the numbers so you can clarify to us what exactly it is that you want LaCann and the members to go out and push as your advocacy agenda item, and how much funding we need to request.
Thank you, sir.
But I will say it is a big price tag. The few legislators that members have been able to meet with have expressed grave concern for the amount of money that we would need to ask for. So keep that in mind. Also keep in mind some of the budget cuts that are anticipated next year due to the COVID-19 impact. And one other thing that I forgot to mention was you guys had placed a caveat in October. Basically, you wanted to work up to a living wage, but you didn't identify what a living wage is, or what you would consider to be a living wage. So that's something that we get questions on as well if this is being presented to legislators and we don't have an answer of what your intent is for a living wage.
Okay, and so we didn't. So these are the issues we have to iron out today. That's the recommendation, as it were, is relates to the questions Brenton's needing answered. What do we consider a living wage? Do we want to ask for this particular item? One, do we want to ask for it all in light of the budget cut situation we now know we will face? And two, if we do keep it, do we want to avoid disparity and ask for both, which would be the 45 million, or would we ask for just one? And if so, which one would we be asking for? So those are really the questions before us today to try to iron out. And the executive committee honestly felt that this was just too important a topic and we were so close to the council meeting that we should all discuss it today. And so that's really what's on the table now before us. Is do we keep this agenda item of the DSP wage increase in light of this data we did get for the cost, and in light of knowing that we will face potential budget cuts this year due to COVID?
Randall, I have a question. This is Mitch.
Yes, Mitch, you have the floor.
Thank you. Can someone just speak briefly on what those anticipated budget cuts are specifically?
Do we have that answer yet, Courtney or Brenton? Exactly.
So I believe the Revenue Estimating Committee actually released something yesterday or the day before. I can't remember off the top of my head, but that amount was looking at a state general fund shortfall or budget cut of $228 million.
Right, and so let's keep in mind that what we would be asking, the funds we would be asking for would be state general funds. And we already know that it appears there will be a cut that amounts to around 228 million or so.
Is it realistic to even be moving forward with an advocacy effort to ask for $45 million if these are going to be, this money's coming out of state general funds and you're anticipating over a $200 million budget cut in state general funds? Are we wasting our time doing that? I just want some opinions here. I'm not sure.
This is Bambi. I haven't had my hand
Yes, Bambi, you have
raised.
the floor.
If I can speak. I mean, we're not, that's the Revenue Estimating Committee's projection, but it's not, there's not including anything that we'll get from the new administration in DC. And so, I think our job, and this is something that we've always said for the years I've been on the DD Council, our job is to advocate on what the developmental disability community needs. It is the legislature's job to identify their priorities. And so we have to say what our priorities are, and then they have to make those budget decisions. So our primary focus is to advocate. So we need to say what the Developmental Disability Council needs.
Well, I agree with
the
you.
developmental disability community needs.
Yeah, I agree with you there, Bambi. I just kind of was wondering if there were any specific areas targeted for those state general fund cuts, like if they were going to target home and community-based services, because we're always on the chopping block when you have a budget deficit.
I don't believe we know the answer to that yet, Mitch.
Okay.
That I'm aware of.
All right. Thank you, Randall. Thank you.
I don't believe we know how those cuts would be distributed.
Okay. Thank you.
You have 7 hands raised.
Okay. Let's try to go in order. Who's first on the list?
I believe Ms. Rosalind Hemel is first.
Yes, Rosalind, you have the floor.
Thank you. What I wanted to know in that is how can, does this go with the budget cutting? Is that going toward like different bills or different, with paying off? Or which way, if we did vote on it, does that mean everything it's going, how can I say, with even with the trainers or the teachers or with other people getting that amount of money or what?
I think with when we talk about the budget cuts, it will have to be
Yeah.
decided for each department, I believe, where those cuts would come out of, and we don't yet have those answers, I don't think. And as Bambi pointed out, we now have a new national administration whose priorities are being worked out. And so we don't yet have a lot of answers as to how cuts would be distributed. We just brought up the point that the Revenue Estimating Committee, which was for our state, has said there will be cuts, but I don't think we have a breakdown of how those would yet be done. And so we're kind of having to make this choice without all the data as it relates to cuts, but we are aware there will very likely be some.
But
so,
how much would be the cuts? Like
we
you
don't
were
know
talking
yet. We
okay.
don't know. Okay. And so who's next on the list? Thank you, Rosalind. And who's next on the list?
Thank you.
Dr. Hyacinth McKee.
Madam Vice Chair, you have the floor.
Thank you, Mr. Chair. I just wanted to remind our council members to utilize the chat box raise hand prompt when you are wanting to ask a question, and wait for the staff to call your order and then allow for the chair to acknowledge you before you jump in and speak. Thank you.
Thank you for that point of clarification, Madam Vice Chair. Who's next on the list, Hannah?
Miss Jill Eagley.
Yeah, I have a question. So I know that COVID's been rough because of the state taxes went down, but in terms of the DD Council, how is that going to level out with the new administration?
We don't yet fully know. But I think the question before us is, do we keep the advocacy agenda as it's there? We're having a discussion of an issue that is on our advocacy agenda. I believe it looks as though everyone's in agreement we should keep it. And if we should keep it, then do we ask for now that we have, because when we first asked, we didn't have the numbers. So Brenton and the staff have provided us with some numbers. And so now we know it'd be a $45 million ask for this one agenda item,
And
which would be direct service.
First of all, I don't know if the DD Council is aware of this. So with the new administration, the providers who support the IDD in all the parishes in the state of Louisiana, I think they're giving COVID stimulus checks. I don't know if anybody's aware of that, but I just thought I embrace that to y'all.
Well, thank you.
You're welcome, Randall.
Okay, who's next, Hannah?
Christopher Rodriguez.
Yes, Chris, you have the floor, sir.
Thanks, Randall. I appreciate it. Yeah, I just want to second what Bambi said. I think she brings up some good points, despite the fact that there is a perceived deficit that they're talking about. I mean, I think most people are fairly confident that the state and city governments are going to get some type of fairly significant bailout by the federal government. I think that can be confident. I think people can be confident as a result of the Democrats winning both the House, the Senate, and now the executive office. So that's something to consider. I know I wasn't able to attend yesterday, the committee meeting, but I know that there's some great folks on it. I'm sure you had some thoughtful banter back and forth as to whether or not you want to advocate, and correct me if I'm wrong, Randall, I think I heard this. One of the other questions, aside from whether or not because of a deficit or perceived deficit that I don't think is actually going to take place, whether or not you would want to advocate on behalf of just the DD providers, or if you would want to advocate on behalf of the other providers as well. Was that a question that you guys were trying to work out? So provided that it is, Randall, I know you guys had a good conversation. Could you provide us with some of the kind of pros and cons, or like just some of the talking points of both of those sides so that we can try and facilitate the conversation? I think that would be really helpful and interesting.
Okay. Well, I mean, Brenton or Courtney, would you like to help out here in terms of the information presented? Because yesterday, I myself, are you talking about the executive committee meeting, Chris? Because it was the other day. I'm sorry, your mic is muted. All right, we can't hear you.
Yeah, sorry, it takes a second for it to click back. But whatever committee meeting you guys had this discussion, I think Tori, our director of policy, was in on the meeting. He had mentioned something along the lines of saying, well, if you have a disparity between the two, it might encourage certain types of providers to go to the other group of people, creating.
Well, I think it most certainly would, and that point was brought up in our executive committee meeting. And I do believe if you're going to ask, I think that you need to ask for both. It would be the 45 million. That's my personal feeling, and I'm the chair, so take that as you will for in the discussion. But I think if you're going to ask, I think it needs to be for both populations.
So I think that's a really interesting point of conversation. Yeah, I mean,
well, okay. Is there any? Did that answer your question?
yeah, I think so. That's it's such a tough question. I don't even know where I stand on whether or not the DD Council should exclusively advocate on behalf of policies that benefit people with developmental disabilities, or if in circumstances like this, when there could be adverse effects on other groups of individuals with disabilities, should we be more inclusive? Like, I don't know what the answer is, but I'm curious to hear, the thoughts of everybody. It seems like a really big question that I'm sure the DD Council has probably had to tackle in the past, but new group of folks, so.
Okay, thank you, sir. All right, Hannah, who's next on the list?
Ms. Tamisha Sonye.
Ms. Sonia, you have the floor.
Thank you, Mr. Chairman. I had to take notes while everybody went over everything. I just want to say something as a board member. I can recall last year when we were advocating for cameras and no one wanted to address, there was a cloud over that due to the price tag of that being a concern. As an advocate, and all of us doing our jobs, we're here to be the voice of the people. We're the gatekeepers of advocacy. And I feel we do the public a disservice if we don't, stand up as those gatekeepers. The price tag of that, sometimes we have to face things and ask for stuff that we know we may or may not receive right off. But we are the push behind that. And I agree with what Bambi said and Chris said. We make a good point when we do our job as advocates. And part of our job is to open the gate and speak up for both. I believe, just like y'all said, both of those areas need to be covered. Because if we don't, we do create, I guess, an additional barrier for people then wanting to look at who's going to be served first when we're here for all. So I think we need to advocate and do our job as asking, for it. And I know we have to worry about budgets, but I think that needs to be over departments and committees that handle those and let them decide what they're going to answer to and what they want. But our job is to be the voice. And I just wanted to make sure that was stated. So I'm in agreement for both as well, Randall.
Thank you. Who's next on the list, Hannah?
Ms. Karanda Corley.
Ms. Corley, you have the floor.
Thank you, Mr. Chairman, and thank you, Ms. Sonia and Ms. Polazola, for your comments, because I'm in strong agreement. I think that we are not abiding by the Federal DD Act if we do not take this opportunity to do a systems change. For far too long, we have had our people, our community, not being able to receive services direct support workers due to limited wage amount. There is a national push, even here in Louisiana, there is a push for $15 an hour minimum wage. I'm part of that push. And I'm asking that we do not lose an opportunity to unify our community and actually follow the federal law. That federal law says systems change, and for far too long, we actually digress away from actually pushing the system. Let's push the system. Our community matters, just like anything else. And right now, they are now proposing another $1.9 trillion stimulus package. The money is available. The money is there. Why are we acting like it's not? Our State Department of Education is receiving $1.6 billion. The money is there. Ask for it. Ask for it. And you will see that we will unify our community, and that it will give our community a dog in this fight to actually be able to ask and get more, including making sure that contracts like Mr. Rivera's and all can actually be fully funded. IDEA can be fully funded. Let's not let an opportunity slip through our fingers again. Thank you.
Thank you. Who's next on the list, Hannah?
Miss Jill Eagley.
Okay, Jill, you have the floor.
Jill, you unmute yourself, Jill.
I just want to understand what Ms. Carondola was talking about so I can get the big picture of that.
Okay, well, she wants us to advocate for both populations. So the $45 million we would ask for so that we could serve both the DD population through OCDD and our aging population, because we do have, and I have stated I'm in agreement with that. If, you know, in keeping with this issue, if you're going to ask, I don't think you want to create a disparity in asking. I mean, you don't want to serve just one set of the population we represent. You want to be fair to all.
Yeah.
So I think that seems to be the consensus we're gathering here today. So
Is that going to be implemented, Randall, in the legislative session dealing with that?
That will be totally up to the legislature. This is about us asking what we're asking the legislature for. And then so as others have rightly pointed out, Bambi and Ms. Saunier both have pointed out, and I believe in their comments, I know, that would be up to the legislature as to what they would be willing to fund, how much and where.
I agree with y'all and Ms. Carondola, because I know times are tough, but I know that if people step up, we can achieve what the DD's Council's mission statement is in dealing with what we have to deal with to move forward.
Thank you.
You're welcome.
Okay, who's next on the list, Hannah?
We have Miss Kelly Monroe with her hand raised.
Kelly, you have the floor.
Hi, thank you for letting me talk. I just wanted to kind of just bring this to your attention about you know, making sure that there's something, if you guys move forward with this, that you put something in the bill that would not allow LDH to recoup that money later if they had a shortage of funds. Also, keep in mind too that if the minimum wage does go up to $15 an hour, the reimbursement rate for the highest rate of waiver is only like 16. So that would not cover any of those costs. And they would have to also increase the rate yet once again to cover that. So I just wanted to just bring that to y'all's attention. It is a huge concern that if you only move forward with OCDD and not OAS, that we already have a workforce crisis. And in that population, they will even have an even more of a workforce crisis. So that's just my 2 cents. Just wanted to, you know, please ask that you put something in the bill if you, or in the preamble or something that says that they would not be able to take that money back. We had this happen, you know, a while back where they gave us $2 to pay employees. We gave the raises, and 6 months later, they took the $2 back. And that's not something that we will be able to with all the costs that we have right now, that's just not something that we'll be able to function with. So thank you for letting me talk.
Thank you for your input. Okay, Hannah, who's next?
Miss Bambi Polazola.
Bambi, you have the floor.
I just wanted to kind of piggyback off of what Kelly said, and we've had discussions in the past over the past several years in regards to our input in regards to wage and labor laws. I think that we're kind of treading in that area that if we try to interfere with those wage and labor laws, it makes us or the Department of Health like the employer. There's no other, and I'm just from another way of looking at it, we don't tell nursing organization or any other provider within our system what they need to pay. It's as if we treat our system and the people who provide our direct service workers as if they aren't professionals in the way that we have in the discussion right now. We pay the providers of all the other medical services a higher rate, and then we expect them to pay their employees. If they want to keep and retain employees, they have to do what they need to do to keep those employees. We need to have those same expectations for the providers of our direct support workers, our personal care attendants. And so, I mean, we can push for this, but I really think we're going to hit a brick wall in regards to our wage and labor laws and the Department of Health getting involved in telling entities what they have to pay people.
Thank you, Bambi. Who's next? Hannah?
We're down to a lot of comments in the chat.
Okay. Well, we're running over schedule, so we're about due for our 10-minute break. Would everybody like to take the 10-minute break now, or do we want to finish this discussion and then take it?
I guess no.
I think it might be better to finish the discussion so we don't lose our trains of thought. But so
let's just go ahead and go for what what we're talking about.
So the executive committee did not make a formal motion. We wanted to have this discussion today, and so what I would need is a motion for us to have to accept the $45 million ask for direct support workers wage increase, which would cover both areas and answer that question. And then the issue would be, is it $2 to the base pay? Or is it across the board?
Actually, I would like to make that motion, for what you was just saying, Randall.
Okay, so we'd have to work on the wording of that.
Hey, Randall, if I could add just a bit of clarity.
Yes, Brenton, please do.
If you go the $2 across the board, every DSP gets a bump up in pay for $2. The $45 million is null and void, because that's not, the $45 million is not for that ask. The $45 million is for the base pay.
I see.
We won't have a dollar figure that we can share if you go $2 to everyone's pay, because there's just no way for us to figure that out.
Okay, I would recommend we use the numbers we had, so that would be for base pay. It's my recommendation to the council that if we do an ask, we do it for the 45 million.
Well, I do agree with what he said and everything, and I am agreeing.
We would need to show the wording on the screen so everyone can read it. So Courtney or Brenton or someone, could y'all help us to wordsmith this like we'd need it?
I'm trying to type it right now. And once I get that typed, I will be able to share the screen.
Thank you. And Hannah, you said there are other questions in the chat box. I guess we can proceed with some of those.
Okay, Ms. Kathy Dwyer said, I understand the budget constraints and concern. However, we have been fighting for fair and equitable DD services for decades. And for decades, we got crumbs. Our workers' pay is far beyond the average pay. They deserve to be brought up to the average pay. And I guarantee you that there will be other less important asks in the budget. We need to make sure we advocate for our workers so our community gets the services they need. The worst that can happen is it won't get funded.
Okay, thank you, Ms. Kathy.
Harlan Kauser said also, how would this be affected if the president raises the minimum wage to $15 per hour? Would that be considered a livable wage?
Good point, Mr. Kauser. I don't know that I'm qualified to answer what a livable wage is. I know that the minimum wage will be a hot topic of discussion, I'm sure, this year across the board. So we'll have to wait and see on that, but we certainly would think that at least minimum wage would be considered as a starting point.
Ms. Kathy Dwyer said, additionally, President Biden has promised aid to state and local governments as well as increasing the minimum wage.
Thank you.
Ms. Melinda Elliott said many times we have to advocate for several years to reach goals for people with disabilities and their concerns. Even if we aren't successful with an increase in base pay this year, it is an opportunity for education for all.
Thank you, Melinda.
Ms. Karanda Corley, I believe it's the same question. Are we considering the push for the minimum wage to be increased to $15 an hour?
The question before us is related to the legislative agenda that we've already set. And so with regard to the specific ask of $15 an hour minimum wage, we haven't taken a formal position on that, but that would not be what we would do here at this point. This is related to the issue on our legislative advocacy agenda, which would be raises for direct support professionals.
Ms. Kathy Dwyer said if we don't keep asking, they will think it's not important.
Thank you.
Ms. Lillian Dejon said she concurs with Melinda.
Thank you.
Ms. Susan Reen said she agrees with Kathy Dwyer and Melinda Elliott. Ms. Karanda Corley said I strongly agree with Kathy Dwyer and Melinda Elliott. Harlan Kauser and Bambi Polazola, thank you kindly for these comments. Melinda Elliott says we definitely need to ask for both. If you don't, it sets all of our people up for competition with each other. Please ask for both. Kathy Dwyer agrees. Karanda Corley agrees with Tamisha Saunier. Harlan Kauser asking for one and not both creates issues that encourage individuals to apply for employment opportunities with the entity that pays better. Kathy Dwyer said, I also am sure nursing homes will be asking for more funds as they regularly do. We need to continue advocating for equity across service systems, and the HCBS service system is not as well funded as nursing homes.
Thank you all. Great points.
Would you like me to keep reading? Or?
Yes, I just wanted to reiterate the
Ms. Tamisha Saunier said, when we advocate, we never have all the answers because we are part of the puzzle. If we do not advocate for open doors to these wages, there may not be the push for the funding committees to do their part legislatively. Ms. Kathy Dwyer said, exactly, Bambi, we need to make sure DD services are treated equally as other generic systems are. Ms. Bambi Polazola asked if she could see the wording on the screen.
I'm working on it. Thank you.
And Mr. Matthew Rivera said, are now stating that the minimum wage for DSWs will be $9.25, question mark.
Is that so it's a question?
Yes, sir.
No, I mean, I don't know what I'm not the decider on what the rates are. I'm just saying, you have to pick a starting point somewhere. I would assume minimum wage would be it. I don't have the answer, Matt. That would be up to the legislature.
And I believe Mr. Mitch Giddens and Kelly Monroe have their hands raised.
Yes, Mitch, you have the floor.
Well, I think I was going to beat to the punch after all the input, which I really love. I like seeing everybody get fired up. That's what we're supposed to be doing. And
exactly, that's why the executive committee wanted to bring this to everybody.
I love it. So I was just going to make the motion that we go ahead and advocate for the $45 million for both OCDD and OAAS programs. I totally agree that we need to advocate for both if we're going to push for the money.
Okay. Thank you, sir. Before we get to his motion, was there another comment, Hannah?
Yes, Kelly Monroe and Miss Rosalind Hemel have their hands raised.
Kelly, you have the floor.
Hey, and I don't know if I heard this right, but I thought I heard that, was it that we were going to go with the base pay of $9 and something cents? Keep in mind, a lot of DSPs make more than that. So I wouldn't set that as the base pay. I think I would try to really figure out how much the $2 an hour would be. I'm just putting that out there. I know that there are a lot of long time, and I know that some people their DSPs are only making minimum wage, but there are a lot of DSPs I know, like within the ARC, that make well over that. So just something to think about. And then also when you raise the rate of pay, it also raises the cost of the employee as far as like workman's comp and stuff like that. There's a percentage on that rate of pay that the employer would also be responsible for. So please keep those things in mind as well. Thank you.
Kelly. All right. Rosalind, you had a question?
Yeah, because I was going to even say, I'm kind of agreeing with, the comments and the one who went before me and that with the pay, even when I'm reading the one in front of me with the $2, but how much could that really go? How far can it go?
We'll have to find out.
Yeah. But, okay, with the 100, if we go with the $122, but you see, for me being in with kitchen aid that I'm in, and I kind of go with like $9.50 an hour. So could that be like a budget range even for me, to really get on my kind of,
I think Kelly made a point similar to yours, and that we would have to look into how this would affect the pay, but the motion's been made. And so you have made the motion, and Mitch, sir, you had a question?
Yes, Randall, my question is, should our advocacy efforts, and this is a question for everybody that wants to chime in, would be better served if we were advocating for a rate increase of $2 as opposed to a $2 base rate increase for the direct support workers? That's a question for everyone.
Well, I believe, and Brenton, correct me here, the 45 million would be for base, because that's what we have the numbers for, right?
Correct. I think Mitch's question is a little different, though. He's looking at a provider rate, so a rate of service, as opposed to this, I guess, $2 base pay increase for the actual direct support worker.
Right. Thank you for the clarification. And so that would be something we would have to discuss, but we have a motion before us. And so Rosalind has made the motion. You see it before you. And so now we would need a second to her motion. It looks like we need further discussion.
Ms. Kim Bazil raised her hand.
Yes, Kim, you have the floor.
Are we not going to put in the motion what Kelly is requesting, that the $2 increase cannot be taken away from the providers?
That's up for discussion. Do you see the motion written before you? Is that something Kelly made? As you pointed out, Kelly made the suggestion. So is that something we agreed that should be in the motion?
I would like to make a friendly amendment to the motion to add that if possible.
Okay, we can amend the motion after the vote. Okay.
Cindy Pulazola said that this is confusing. She doesn't understand what that means.
Okay, Bambi, would you like the floor?
I don't understand what you mean by base pay increase. I mean, you can add $2 an hour to the rate that we're providers, or there is the cost of the employer cost, which is all of the payroll taxes, all of the workman's comp insurance that's based on pay. So if you give employees $2 more an hour, the cost to the provider is probably about $3 an hour. So what does this mean?
Point of order, Mr. Chair. If you don't mind,
Yes,
may I have the floor?
Madam Parliamentarian.
Okay. A motion has been made, and so there should be no discussion at this point. There needs to be a second to the motion. And then once the chair restates the motion after there has been a second, you can then discuss it such that you can amend the motion to include necessary to reword it and craft it the way that you need. But at this point, the chair needs to process this motion appropriately, which means a motion is made, a second needs to be made. The chair then restates that the motion has been made and seconded, opens it up for further discussion. And from there, you all can then discuss it further, craft the motion, and then vote on it. Thank you,
Thank you for
Mr.
that
Chair.
point of clarification, Madam Parliamentarian. Okay, and so as I stated, the motion is on the floor as you see before you. And there is, the parliamentarian correctly pointed out, we can begin to further discuss it, craft the wording, change what we need to change if we feel the need to do so. But do I have a second to Rosalind's motion?
I'll second the motion, Randall, so that we can move forward.
Thank you, sir. So we have a motion from Rosalind, seconded from Mitch, that says motion for the council's fiscal year 2021 legislative advocacy agenda item to request a $2 base pay increase for direct support professionals within all home and community-based service providers. And again, this motion is made by Rosalind and Heimel and seconded by Mr. Mitch Edens. Do I have any objection to the motion? Do I have any abstentions?
This is Julia saying.
Randall, this is Matt Rivera. I will abstain as well.
Thank you.
I would like to abstain. It's Jelena.
Okay, your abstentions are all noted.
Randall. This is Tamisha Sonia. I'm abstaining also.
Okay.
So Sarah Fletcher, I'm abstaining also.
Okay, is that everyone who abstains to the motion? Do
We
I have
have a
any
few
more
hands
abstentions?
raised as well. Mr. Christopher Rodriguez, Michelle Guillory, and Karonda Corley.
Okay, noted. So do I have any objections to the motion? Any objections to the motion?
Mitch Edens has a question and a few hands are raised.
Okay, well, we need to, I'm still waiting. I have no objections, so motion passes. Hearing no objection, motion passes. And so now,
Hey,
Mitch.
I'm sorry, I object. This is Bambi.
Oh, you object, okay.
I objected as well. We're gonna need some support from staff to help bring order to this meeting. It is really going completely off. I mean, we need, thank you, Ms. Parliamentarian. I apologize for inserting. Thank you, Madam Parliamentarian, but we're gonna also need staff to help monitor this chat box, monitor the hands that are being raised. This is going completely off track. And so that's why my hand has been up for probably the past 3 minutes. We need order to the meeting. And yes, I am objecting as well.
Okay. So we have 2 objections to the motion. Madam Parliamentarian, would you like to advise us now?
Yes, okay, so moving forward, so if of the people who voted, not including the abstentions, but of the people who voted, if you have a majority, the motion carries. If you do not have a majority, the motion dies. Moving forward, when a motion is made, a second, and then you restate the motion, you can then open it up for further discussion to allow the motion to be amended, changed, reworded by way of a motion to amend, to strike out this, add that, to include whatever language to craft it better. And then once those amendments have been disposed of or addressed, you can then take the amended motion to a vote to allow everyone to have participated who wants to, and then vote on the final outcome of what that amended motion would be. So moving forward, please keep that in mind, you all. Once the motion has been made, seconded, restated by the chair, it is then open for discussion once again to allow you to craft that motion the way that you need before you take the vote. So again, I yield back to you, Mr. Chair, for the results of the vote.
The results of the votes is majority have I think we need to do a roll call vote to make sure. So Hannah, could we do a roll call vote?
Yes, we can. Dr. McKee?
Object.
Is that a nay?
It's a nay.
A nay.
Okay. Dr. Baravecchio?
Abstain.
Ms. Bazil?
Object.
Ms. Bayham?
Abstain.
Mr. Billings?
I'm a no.
Mr. Bristow?
No. No.
Ms. Setnar? Ms. Setnar? Ms. Cosse? Ms. Dejan?
No.
Ms. Eagley?
Object.
Ms. Guillory?
Abstain.
Ms. Foster Hagan,
Abstain.
Ms. Hayno,
Was that mine? You calling on me?
no, Ms. Hayno, Jill Hayno,
Oh,
I'm sorry, I heard email too. I abstain.
Ms. Hymel, Roslyn,
yes.
Mr. Iddens,
No.
Ms. Katzman,
I abstain.
Mr. Nguyen,
Yes.
Ms. Polozola,
No.
Mr. Rodriguez,
Abstain.
Mr. Rivera,
Abstain.
Ms. Sonye,
Abstain.
Ms. Tarver,
No.
Ms. White. Oh, she's not here. Dr. Wilson. I believe also not here. So that's 9 no's, 2 yeses.
Okay. Motion does not pass. So we would need to continue discussion of the original issue before us. But before we do that, we are well behind time for our 10-minute break. And so I would propose a motion for a 10-minute break, and then we would come back to this discussion.
I could do that.
Thank you, Rosalind. So I have a motion for a 10-minute break. Do I have a second to Rosalind's motion?
A second, Randall.
Randall.
Thank you, Mitch. So we have a second. Do you have any objections to taking a 10-minute break? The motion for a 10-minute recess. Hearing none, the motion carries, and we will reconvene at 10:48. Thank you all. Courtney or Brenton. It is now 10:48. Do we have a quorum?
If council members will please share their screen again or start their video again, please.
I'm here, Randall, but I gotta go take care of something very quickly.
Okay. Thank you.
We have a quorum, Mr. Brown.
Okay, give me just 1 second, please. Okay. Thank you, everybody. Welcome back. Okay, so now the motion before us failed. And so now we would need a new motion. But before we do that, Brenton, could you speak to clarify when we talk about base pay, what we're talking about? I think there was confusion with relate to the base pay.
I mean, basically the base pay would be added on to whatever the minimum wage currently is, which is $7.25. So that $45 million would basically say that you would start at $9.25. So this would be for anyone that is currently making minimum wage or that is making less than $9.25. It would apply to them. It would just say you have to at least start out paying your direct support professionals that you hire $9.25. The way we got to that number is we met with the department after the agenda item that was put forth last or at the October meeting. I just realized my camera's not on. That we put forward at that y'all had put forth and voted on at the last meeting, and kind of wanted to get guidance from them how they think we can possibly do this. And so one of the things was the discussion that we had of how we really cannot figure out how you would tell a provider if someone is already making $15 an hour, you need to pay them 17. If someone's already making 9, you need to pay them 11. And then even if you could tell them to do that, how exactly can you figure out how much that would cost? We don't know. There's so many variables. And I think, I mean, that's a lot of DSPs that you would have to try to figure out for every single pay. I don't think that's something, if you're trying to go that route, that you can accomplish now, because that's going to take a lot of time, effort, research that you just don't have before your session to try to figure out a plan for that. So one of the things that was discussed was in the past, some years ago before my time, so I would have to defer to others as far as history about all this goes. In the past, they've put it into, I believe it was the rules at the time, that they would pay that, I think it was either $1.50 or $2 more on that base rate. The problem is once minimum wage, the federal minimum wage exceeded what that rate was, it no longer applied. And then I think the most recent time that they've tried to pass through, I think is what Kelly had mentioned for all of you earlier, is that there was not a condition that prevented the department from taking it away. So as soon as they tried to give that pass through to the support workers, whenever rates were cut or whenever there were any sort of cuts made, they could take that away because there was nothing that kept that pay. There was nothing that maintained that pay. So part of the ask that we were recommended to bring back to you guys would be for that, what they refer to as a base pay. So essentially it just creates a new minimum wage for a direct support worker. It's not the federal minimum wage. It's going to be, if you would have gone with what the motion was or something similar, it would be $9.25. I think that's what Matt had alluded to in one of his comments. That's what it would be if you do the $2 on top of that current minimum wage. And that's what the $45 million is for. If you alter in any sort of way, I don't have data for you. We have to go back to square one. Just keep in mind, if you're moving forth with this agenda item, we just are going to need direction because you've got roundtables that are rolling out. You have leaders that are doing legislative visits, and we have to start prepping for session now. So you got to figure out what it is you want to be advocating for, and we need to be able to move on that. But as far as historical knowledge, I would defer. I think if Kelly is still on, I think Julie's here. They probably have some knowledge about any historical aspects of this that you have questions about. But that's what we have. The 45 million would increase that base pay, which is the current minimum wage, increase it to $9.25. And we would also, in that request, ask that the department update the rules so that would be in there. They can't just take it away.
Thank you, sir. Then I would strongly recommend that if we make a motion, that it be based on the data we have information for, which would be the $45 million. So hopefully that answered questions. Does anybody have any further questions of Brenton?
Ms. Karanda Corley has her hand raised, and Ms. Bambi Polazola has a comment.
Yes, Ms. Corley, you have the floor.
Thank you, Mr. Chairman. And I'm speaking, I have this question because it's directly in conjunction with the comment that Ms. Polazola is making. Is there a way to simultaneously increase the rate that the providers receive while we increase the rate that the actual direct support worker will receive? Because it's not fair to have the direct support worker receive an increase and then the company that hires the direct support worker does not get to make money as well. Now, let's be honest here. Everybody has a job. So your employer is not going to keep you hired if they cannot make a profit as well. So is there a way for the company to still actually make a profit and not end up becoming in the red or have a negative, while we also have the direct support worker to actually get an increase? And because I'm all for the direct support workers receiving their increase, but I also don't want us to be in a situation where we have more businesses going out of business because they are not able to meet the expenses.
Okay, thank you. Is there someone that could feel confident to speak to Ms. Corley's issue or question? Because I'm personally not aware of a way. I think we could put it in the motion to have that be the goal, but I don't know if I'm the right authority on that. So I'm asking those who have more knowledge of this than I do. Would y'all like to speak to her question?
I believe Mitch has, I don't know if he has a question or a comment, but.
Okay, Mitch, you have the floor, sir.
I kind of agree with what Ms. Corley is saying, and that's why I had asked earlier before we moved forward with the motion if we should be discussing, continue our discussion about the rate increase for providers, because in doing that over time, providers are going to pass that rate increase down to their workers, and they're going to give them raises and those sorts of things. I think all good providers are wanting and willing and want to do that. But if I'm an employer with overhead costs and expenses, I'm not going to be capable of doing that unless I have the money to do that. So with a rate increase, that would give me the money to do that, pass that, you know, that DSW raise down onto them if I had a, you know, if the rate increased to the provider. So, you know, we've been talking about this rate increase for the last couple of years now and getting it up to par where it should be for providers across the state. So I'm wondering if we could just change our language, and I want input on this, as opposed to a base rate paid for the DSW, that we just continue to advocate for a rate increase for providers and let the providers do the right things. Now, I know a lot of people say, oh yeah, but there's those providers out there that they won't pass that down to their DSWs. Well, if they don't, those DSWs are going to move on to those providers that will. You know, they talk, and they're going to move on to those providers that are paying a decent rate or a better rate. So my advice would be to let's continue to advocate, if we're going to push for $45 million, that we do that as a rate increase to the provider. That's my opinion, but I want everybody else's input on that. Thank you.
Thank you, sir. Bambi, did you have a question or a comment?
No, I'll put the comment in the chat, and it doesn't need to be read. Thank you.
Okay.
Mr. Christopher Rodriguez has his hand raised.
Yes, Chris, you have the floor, sir.
Thanks. So just some clarifying question, because I just don't know a lot about this, which is the primary reason why I abstained. So it sounds like we're pretty much in agreement that if we're going to ask for an increase, we're going to ask for it across the board of all HCBS providers, not just DD HCBS providers. And we're going to ask in the base rate that the actual DSW gets paid. I think that's correct. I guess the question is, if I'm a provider and a DSW, and are the base rates for the DD population the same as the base rates for the other HCBS provider, I guess is my question.
That's a good question. Brenton, you might be able to speak to that better than I could. Or Kelly, perhaps.
I think that answer would be more appropriate coming from one of our provider reps.
Yeah, I can answer that. I mean, currently, Chris, our only requirements are that we pay minimum wage and overtime under the Fair Labor Standards Act. So that's the only floor that we currently have. I will say this, Chris, that we provide both DD services as well as Office of Aging services. And the DD services are more intensive and harder to find labor. Just because they will have more needs, require more transportation, et cetera, et cetera. I'm not advocating for splitting it. I would just say right now, our only floor that we currently have is the Federal Fair Labor Standards Act, which says we must pay minimum of $7.25 an hour and overtime for any hours greater than 40 in a given week. I liked it. You know, right now the department has what's called hazard pay. And I think the way that they've done it is the provider rate increases for $3 per hour. However, the provider must increase pay by at least $2 for that direct service worker. So there is something currently in place right now that sort of mirrors what we're trying to do. You know, the base rate of $9.25 an hour seems appropriate for IDD services for sure. And I would my only suggestion would be to ensure that the rate increase is proportional, that we can pay providers to also pay the fringe benefits that are required under the law, such as unemployment tax, workman's comp, Social Security, Medicaid, et cetera, et cetera. So I hope I answered your question, Chris.
Ms. Kelly Monroe also has her hand raised.
Yes, Kelly, you have the floor.
Sorry. So
I was just gonna say what basically to answer the question is no, there is no base pay right now, but I'm wondering if Julie can kind of talk a little bit about, because this came up last year, and I remember Julie saying something about them not being able to do that, that mandating a certain base pay was an issue. And I'm wondering if she, I'm not sure if she's still on or not, but if she is, if she could talk a little bit about that.
Julie, are you available?
I am, but I'm actually texting Charles Ailes right now to try to get him to help me kind of remember some of those things. I know last year when we were talking about advocating for this, that one of the things we were looking at was a way that we could set, was there a way that we could give the rate increase and make some requirements on the floor, or that there be a floor rate? And I'm not recalling all of the details right now. I'm trying to get them, but there was our legal department was taking a look at what were some of the things that we might put in place that would safeguard things. There has been, just a note too, for the last at least 2 or 3 years, in the preamble of House Bill 1, which is where the legislature identifies, how it breaks out how the state funds are going to be done. There is in the preamble something that says that disability services, the rates for disability services cannot be cut. So to the comment about not being able to take it away, there is something currently in the preamble, which, if you guys chose to, could continue to advocate that be included in the preamble. But there is language there now that would prohibit us from being able to do what you guys are saying.
Thank you.
Kelly, I can speak a little bit about the issue I think you're alluding to. It's considered joint employment. Currently our DSWs are employed by the provider, but also the family member serves as an employer as well. So our direct service workers are jointly employed. If the department would set a floor rate or a rate that we would have to pay our direct service workers, they in too, based on the Fair Labor Standards Act, would be considered an employer because they are setting the rate of pay. And that would expose the department to potential litigation when it comes to overtime pay, violations of the Fair Labor Standards Act by not necessarily by the department, but then by another one of the joint employers. So it does get a little bit complicated when the department becomes very prescriptive on what we pay our workers, because they then themselves become an employer, which would open themselves up for litigation, particularly when it comes to not paying overtime, maybe not paying certain aspects to that employee. So I hope that helps. I'm no authority on it, but that is what I read back in 2015 when we had to begin paying overtime years ago.
Thank you all for that input.
Randall, I think Kelly, her hand went down. I don't know if she had more to add.
Kelly, do you have any more to add or a question?
Yeah, just wanted to kind of talk a little bit about the hazardous pay. The hazardous pay is, they do have something in place, but it's really only for people who are working with someone who has COVID or is working in a home where someone in the home has COVID. And it's only for a very short period of time. So I just wanted to elaborate a little bit on that. And then also just, and I can only speak for the ARCs, but I know a lot of other providers, and I know they feel the same way. I know that we want to pay our DSPs more, but we have to be able to cover the cost. We are a nonprofit, but we still have to stay afloat. So all the costs have to be covered. Otherwise, it puts us in a bind in hiring quality employees. So just, I'm not saying like people don't want to give the raise to the DSPs, but in giving the raise to the DSP, they need to have all the costs that come with that raise to be covered. That's all. That's it. Thank you.
Thank you. All right, I know that was a lot of information for everyone, but we still have the issue before us. And so do I have anybody who's willing to make a motion at this point? Yes, Mitch, your hand is raised, sir. You have the floor.
I would like to make the motion that we change the language, that we not advocate for a base pay rate to pay DSWs, but to advocate for a provider rate increase of $2 and advocate for the 45 million for that cause.
Okay, do I have a second to Mitch's motion?
This is Mike.
I'm sorry, Mike, did you second?
Yes, sir.
Okay. So I have a motion from Mitch and a second from Mike that the $2 provider rate increase. Do I have any objections to the motion? Any abstentions?
Julie Hagan abstains.
Thank you. Noted.
Matt Rivera.
Patty Baravicchio abstains.
Okay, I think we best just do a roll call vote. So Hannah, could you please do a roll call vote for us?
Yes, sir. Dr. McKee?
Yes.
Dr. McKee, yes. Dr. Baravecchio?
Abstain.
Dr. Baravecchio, abstain. Ms. Bazil?
Abstain.
Ms. Bazil, abstain. Ms. Bayham? Is Ms. Bayham on?
Abstain.
Ms. Bayham, abstain. Mr. Billings? Mr. Billings?
Yes.
Mr. Billings, yes. Mr. Bristow? Mr. Rashad Bristow? Okay. Ms. Setnar?
Yes.
Ms. Setnar, yes. Ms. Kosei? Ms. Dejan?
Yes.
Ms. Dejan, yes. Ms. Eagley?
Yes.
Ms. Eagley, yes. Ms.
Yes.
Guillory? Ms. Michelle Guillory?
Abstain, please.
Ms. Guillory, abstain. Ms. Foster Hagen?
Abstain.
Ms. Foster Hagen, abstain. Ms. Hayno? Ms. Jill Hayno? You're muted, Jill.
Is it out of order to ask what the motion is?
No, I can restate the motion. Mitch's motion is to ask for a $2 provider rate increase, and here it is on the screen. Finally, thank you. The new motion before us is for the 2021 Legislative Advocacy Agenda item, request a $2 rate increase for direct support professionals within all home and community-based providers. And that's been made by Mitch Iddens and seconded by Mr. Mike Billings. And that's what we're discussing. That's what we're voting on now is this motion.
Yes.
Ms. Jill Hayno, yes. Ms. Roslyn Hemel? Roslyn, are you there? Okay, Mr. Iddens? Mr. Mitch Iddens?
Excuse me, Courtney, this is Rashad. For some reason, my Wi-Fi is shut out. I just want to let you know, my vote is yes.
Thank you, Mr. Bristow. That'll be recorded.
Mr. Bristow, yes. Mr. Iddens, are you there? Okay. Ms. Katzman?
I abstain.
Ms. Katzman abstains. Mr. Nguyen?
Yes.
Mr. Nguyen, yes. Ms. Polozola?
My vote is yes, but I think the wording of the motion is questionable and not written as what's intended.
Okay, we can have further discussion on clarification once the vote has been taken. But your vote is a yes, Bambi?
Okay. Ms. Polozola, yes. Mr. Rodriguez?
I'm going to abstain.
Mr. Rodriguez abstains. Mr. Rivera?
Abstain.
Mr. Rivera abstains. Ms. Saunier?
Abstain.
Ms. Saunier abstains. Ms. Tarver?
Yes.
Ms. Tarver, yes. Dr. Wilson? I don't believe he is on. That is 10 yeas and 0 nays.
Okay, so the motion has carried. And so now do we have questions as to wording of the motion? So that we make sure we accurately capture the intent. There, you see the motion before you go on the screen is,
Point of order, Mr. Chair.
yes, Madam
Okay.
Parliamentarian.
So the motion has passed as it's written. What I recommend is when you go to ask, as long as you're asking for the $2 rate and asking for it for the providers, you can word it in whatever way that you need to. But for the purposes of the motion passes as it's been stated and voted upon on the screen. Again, I just recommend once the motion is made and a second is made and the chair restates the question, open it up for discussion one last time so that you can amend the motion, craft the wording to the specificity of your needs. And then once those amendments have taken place, then vote on the motion that you clearly feel comfortable supporting in the wording that you need it to be in to move forward. Thank you, Mr. Chair.
Thank you, Madam Parliamentarian. And I didn't have the written wording before me when we began the process, and so that's why I didn't ask. I didn't have anything to ask clarification on, and so I apologize for that, ladies and gentlemen. But having said that, and the motion has passed, before we move forward, everyone is in agreement with the motion. For my own clarification.
I think Bambi has her hand raised.
Yes, Bambi.
I think what we meant by home and community-based services is our direct support workers and our personal care attendants, whatever word, however you refer to it. But home and community-based service providers, there are a lot of home and community-based services within the plans. So what it's actually saying is within all home and community-based service providers, it really shouldn't say providers. It should be, I think the intention was that to have a rate increase for direct support workers or for the personal care attendants, because it's just referred to differently. So I think we have it right. It's just whenever, as she said, whenever we actually put it into policy or talking about it, we need to be very clear about that.
That will be noted. Thank you. Okay, thank you, ladies and gentlemen. This,
Randall?
Yes.
Sorry, just as a point of clarity, I read the comment that Mitch made before he initiated his motion, and he said it was a $2 rate increase to providers, but this says a $2 rate increase for direct support professionals. So I don't know.
Our intent, I believe, was providers. That was Mitch's intent. The wording got written after the fact. And so I think y'all just, whoever wrote it was just trying to encapsulate it and forgot the language. But we need to go with the language that Mitch said, and that's providers.
So are you advocating for a provider rate increase, or are you advocating for that $2 for the direct support professionals as it says? I just think it needs to be clarified so everyone's on the same page about their motion.
Mitch, what was your intent, sir? It's your motion.
Red, I'm sorry.
Okay, it sounds like Mitch is having some technical difficulty.
Randall, can you hear me?
Yes, we can hear you now, sir.
Yes, the language should say for providers.
Okay. So we need to change that, and I don't think we're in any kind of violation because we didn't have this up on the screen. We weren't working on this in real time, but I think everyone's intent is clear.
Sure.
Mr. Rodriguez has his hand raised. And
Yes, Chris, you have the floor.
Thanks, Randall. I would just encourage us, or I don't, sorry, the thing speaking. I don't know if we need to assign somebody to reach out maybe, but you know, as we move forward and start to advocate for the position we've taken today, I'd encourage somebody representing our group to reach out to the groups that represent the other HCBS folks, so the OAAS folks. We sit on a group that's focusing on increasing HCBS services for nursing home folks, which is that other side. Just keep in mind that, you know, as we sit here in the DD side, we've already, you know, hypothetically, I think very much so, taking care of the waiting list. There's no waiting list, you know, for HCBS services in the state of Louisiana, things like that. But if you switch over to the other side
my tablet froze.
of the OAAS side, we have to remember that they still have waiting lists over there, and we're fighting over there to address those waiting lists. I'm not talking on behalf of that group over there. It's the Live at Home Coalition, although we are a part of it. I don't know where I stand on this because I have to learn more. But I don't think it would be unreasonable for the folks that are fighting over there to say, hey, listen, you know, this is going to cost money. We would rather keep our providers at the current rate and use that money to get people out of nursing homes and reduce the waiting list rather than spend money increasing the provider rates for our folks, which are not the DD folks. So I think having a good line of communication to see how they feel about the fact that we're going to be advocating a position on behalf of their folks might be beneficial to see where they stand. Because again, they might think that a better use of those dollars is not increasing provider rates, but actually reducing the waiting list for HCBS services. So something to keep in mind.
Okay, thank you, sir. That's noted.
Dr. McKee made a comment.
Madam Vice Chair, you have the floor.
My comment is in the chat box. We could make a motion to amend this previously adopted motion for it to clearly state what needs for it to be said. Bambi had some recommendations. Mitch has some recommendations. I think we've been on this topic for an extensive period amount of time. So is it possible that we can get clarification from Bambi and or Mitch on how they will, if they would like to introduce an amendment so it can state clearly what it needs to be said so that we can move on and get back to the agenda. Thank you.
Agreed, Madam Vice Chair. Thank you. And so Bambi and Mitch, do you would you like to make a motion to amend the motion with the exact language you have in mind? Would either of you like to make and second that motion? Amended?
My question is, as whoever's typing the changes to the motion now, is that what you're asking me to approve or clarify what I propose?
I think we want to just make certain, since we had this confusion on the wording, because we didn't have the words before us as we voted. So I think we want to make sure there's no confusion, that you're okay with the wording. And if not, do you want to make an amendment to this motion to make sure the language is exactly as you intended, or is this?
What I'm reading on the screen now is exactly what my motion was, that we request that we advocate for a $2 provider rate increase for providers in all home and community-based services.
Okay, and Bambi, are you good with the language as it's on the screen, or would you like to make an amended motion to add some language or clarify?
So the second part where it said increase for all home and community-based service providers, that includes all home and community-based service providers is much more than direct service workers. So that needs to be clarified. So the $2 provider rate increase for, I'm not sure the language that should be increased for all increase. I'm not sure how to word it, but basically it's not all home and community-based service providers. It's specific to the service of the direct service worker, whatever that's called. Matt might know what the technical term is for the rate for direct service workers.
Okay, so you would like to make an amended motion to change the language of home and community-based service to, I'm not sure the exact term either, but direct service professional perhaps, or provider.
Somebody made a comment. I'm sorry.
Yes. Mitch.
$2 rate increase for direct support provider agencies. Is that acceptable, Bambi?
No, it's just the technical billing code for the direct support workers. I need somebody, maybe somebody in LDH or Matt or Kelly might know.
I believe Julie and Chris have their hands raised, so I don't know if they have an answer to that.
Julie, would you like to speak to this, please?
Yeah, so it is confusing because it's called a little bit something different in every waiver and state plan service. So depending on what the intent is, you could either say for, if you want it to be for in-home services that people get in their homes only, then you could say for all in-home direct care services, and we can extrapolate that across billing. If you also wanted it to be for vocational type services, I think that's where the confusion gets in. There's multiple service types. So it just, at the risk of opening another can of worms, that is, it would depend on if the will of the committee was for all of the services where a direct service worker is included, which would include your vocational and your in-home services, or if there was a focus on one or the other. But you could just say an increase to services offered by direct support workers, and the department could then drill down into the specific terminology for that.
Bambi, would you be in agreement to add that language?
Yeah. So it would be to request a $2 provider rate increase for all home and community-based services, take out provider, services provided by direct service workers.
Okay. Is everyone good with that language?
Chris Rodriguez and Jill Hano have their hands raised.
Yes, Chris, you have the floor.
I do agree with it and all.
Hold on, Rosalind, I'll call on you next, okay?
All right, I'm sorry.
Chris a chance to speak, okay? Chris, you have the floor.
Thanks, Randall. So I just wanted to go back and make sure that what we're going to be advocating for is actually going to of the individuals that are actually providing the services. And I think I kind of like the language that was mentioned previously that it's been used for the hazard pay, saying, you know, we're going to advocate for a certain increase in the provider rate, but X% of that needs to go directly to the direct support worker. And I know there was an argument made that, you know, basically like a trickle down economics kind of argument saying that, well, obviously the provider, it's in their best interest to pass that increase down as they deem appropriate to their workers. And if they don't, then somebody can go somewhere else. But we have to remember that, you know, there's a lot of rural pockets in the state of Louisiana, and a provider might be one of the few providers in a rural area and really kind of monopolize that area. So if I'm a worker at that place, I really don't have the opportunity to go somewhere else unless I want to move, which is a really strong undertaking. So I'd entertain, you know, I'd hope that, I'd ask that we entertain the idea of putting some type of provision on this that allows for the provider to undertake what will be probably fringe benefit increases, but also mandating that, you know, I would say the majority of those funds that are going to be allocated, if they were to be allocated, would go to the actual worker. I'd be curious on how people feel about that. I'm also interested if anybody knows the number of people that are actually being provided the base rates. Are these individuals typically being provided fringe benefits? Is that like a typical thing? Can we say like the vast majority of direct support workers are being provided health care through their employer? I don't know if that happens or not. So that would inform me on the percentage in which we would allow the provider to have a piece of that $2.
Matt, Julie, or Kelly, do y'all have any information that could better answer Chris's question?
And Chris, you'd have to refer back to the cost reports. I mean, again, fringe benefits are required by law. Now, do all providers follow the law? You know, I don't know that for a fact, but the fringe benefits that I mentioned earlier are required by the Fair Labor Standards Act. I do believe the department has a percentage based on cost reports that were submitted by providers. I don't have that number in front of me. I think it's around 23%. So in other words, if you're paying a direct support worker $1, for instance, it's costing you $1.23. But again, that can be confirmed through our cost reports that have been submitted to the department.
Great.
Ms. Kelly Monroe has her hand raised.
Kelly, you have the floor.
Hey, so I think that it's all employees over, I can't remember if it was 30 or 32 hours. You had to offer them benefits. So, and that was done by the Affordable Care Act. So I hope that answers your question. So if they are, in which we do consider 30 hours a week full-time, if they are 30 hours a week or more, you do have to offer some type of health insurance and some type of like benefits to them. So, but that doesn't help the part-time.
That's super. Yeah, that's helpful. So maybe we could think of, or be curious on how people feel if we added language that says something like no less than 75% of the rate increase will be directly provided to the direct support workers or something like that. That would leave 25% of the increase for fringe benefits and things like that.
Okay. So the amended motion we have is on the screen in red. Do we, the language is as follows. All right, and this is for the fiscal year 2021 legislative advocacy agenda item to request a $2 provider rate increase for all home and community-based services provided by direct service workers. Is everyone in agreement with that language? Is there anything we'd like to see added to the language?
Jill Hano has her hand raised.
Yes, Ms. Hano, you have the floor.
Okay, thank you. So this specific motion, it's just home and community based, it's not intended to go to OAAS waivers as well. It's just the 4 home and community based waivers.
The intent would be for waiver programs for both OCDD and Office of Aging and Adult Services who have waiver programs to both receive.
Then shouldn't the wording express that?
I think it does.
Oh, okay.
It's very generic, but I think it's so generic that I think it does.
Okay, just wanting to
Thank you.
Sure.
Any other questions or concerns about the wording of this motion you see before you? Are we all happy with the motion as the amended motion as it is now written?
I believe Chris has his hand raised.
I'm sorry, I didn't hear you, sir.
Chris Rodriguez has his hand raised.
Yes, Chris, you have the floor. Chris, the floor is yours, sir.
Thanks, Randall. So I would like to add the language. I'm not sure what percentage. I'll throw out 70%. Language that says no less than 70% of the provider rate increase will be given to the direct support worker, or something. That was very articulate, but
so can we please add in that language? Thank you. Now I'll read the motion as it now states, is now stated. So the council's fiscal year 2021 legislative advocacy agenda item to request a $2 provider rate increase for all home and community-based services provided by direct service workers, with no less than 70% of the increase being provided directly to the service workers. So that's now the motion we'd have before us. Are there any other suggestions, additions, concerns? In other words, it's still open for discussion.
Rosalind Hemel has her hand raised.
Yes, Rosalind.
I might have a question in that, but I have it in two of it. And that for one, can I be excused because I'm going into another meeting for one? And is this what we are discussing?
Yes, we're discussing the motion on the screen. And whenever you need to leave, you are free to be excused.
Well, that's why I'm asking now, because I'm not in my house where, I could have privacy. So
Well, we didn't arrange for that beforehand, so,
yeah, I
it's
didn't know it.
it's
I didn't
okay.
know what time offhand.
It's
so I
okay.
couldn't get.
It's okay. We can just be absent. That's okay too. So
I will still have it on, but I will kind of,
understood.
have.
Thank you. Thank you for being present.
Okay.
So the language I have on the screen, is everybody good with it? Any other additions need to be made to the amended motion?
You have a public comment?
Yes, Hannah, could you please read them?
Harlan Kauser said, how will this apply for individuals who have self-direction?
Julie, could you possibly speak to that?
Sorry, I went to grab a cup of tea. So if you're in, let me make sure, let me read, okay. So the rate, the provider rate is the same, the rate for the service is the same, regardless. So if the rate increases, well, you may want to request a $2 provider rate increase. You're actually not asking for the provider rate increase, you're asking for the billing rate or just for the rate to increase. So if the will of the council is that it should be included for those in self-direction as well, if it were amended to just say that you request a $2 rate increase for all home and community-based services, that may make it more clear that it increases the actual billing rate and then therefore would be included in self-direction as well. Does that answer the question?
Yes, it does. Thank you. So now I think the question is, do we need to add that to the language? We need to modify the language? Or are we good with the language as it stands?
You have 2 public comments. And Ms. Kelly Monroe has her hand raised.
I'm sorry, Hannah, I could not hear you. Could you please repeat?
Yes, Ms. Kelly Monroe has her hand raised and you have a couple of comments.
Yes, Kelly, you have the floor.
I'm sorry, you guys. Just wanted to quickly say that last time when we did restore the rate and it was for home and community-based providers, technically self-directed families were considered as a provider and the money went to them as well. That's all.
Thank you, Kelly. Who else did we have comments from, Hannah?
Mr. Mitch Eden said that was the original motion. And Ms. Liz
He would
Gary,
like to make the motion?
he said that was the original motion.
Okay.
And then Ms. Liz Gary said, yes, I believe you should include self-direction.
Thank you. Okay, so what I need now is a motion. Someone willing to make the amended motion, either that you see before you. It would be the motion that you see before you or any other. Is anyone willing to make a motion on this topic?
I'll move.
Dr. Hyacinth McKee.
I'd like to move.
Okay, thank you, Hyacinth. My mic is not working properly, so I apologize, y'all. I'm trying to work on it. So it's Mitch's motion, right? and then seconded now by our Vice Chair Hyacinth McKee. Is that correct, Hannah?
You're on the amended motion, Randall.
I'm
I don't know.
sorry.
I don't know if that was, I don't know if Mitch did the amended motion.
All right, well, we have the amended motion before us. I'm trying to figure out who made the amended motion. It's not listed.
The amended motion was made by Chris Rodriguez.
Okay, thank you, sir.
I'll second it.
So it's made by Mitch and seconded by Chris. I'm sorry, made by Chris and seconded by Hyacinth. So now we have the motion before us, and I'll read it again now that we have the motion in a second. The motion before us is the amended motion for the council's fiscal year 2021 legislative advocacy agenda item to request a $2 rate increase for all home and community-based services provided by direct service workers, with no less than 70% of the increase being provided directly to service workers. And again, it's made by Chris Rodriguez and seconded by Hyacinth McKee. Do I have any abstentions? Does anyone abstain?
Julie Hagan abstains.
Thank you, Julie. Noted. Do I have
Lee Vecchio abstains.
any objections?
Randall, this is Tamisha Sonia, I abstain.
Let's just do a roll call vote because this is going to get murky. So let's do a roll call vote on this.
Okay. Dr. McKee?
Yes.
Dr. McKee, yes. Dr. Baravecchio?
Abstain.
Dr. Baravecchio, abstain. Ms. Bazil?
Yes.
Ms. Bazil, yes. Ms. Bayham?
Abstain.
Ms. Bayham abstains. Mr. Billings?
Yes.
Mr. Billings, yes. Mr. Bristow?
Yes.
Mr. Bristow, yes. Ms. Setnar?
Yes.
Ms. Setnar, yes. Ms. Dejan?
Yes.
Ms. Dejan, yes. Ms. Eagley? Ms. Jill Eagley?
Yes, yes.
Ms. Eagley, yes. Ms. Guillory?
Abstain.
Ms. Guillory abstains. Ms. Foster Hagan?
She abstained earlier.
Ms. Foster Hagan abstain. Ms. Hayno?
Yes.
Ms. Hayno, yes. Ms. Heimel? I believe she left. Mr. Iddens?
Yes.
Mr. Iddens, yes. Ms. Katzman?
I abstain.
Ms. Katzman abstains. Mr. Nguyen?
Yes.
Mr. Nguyen, yes. Ms. Polazola?
No.
Did you say no?
No.
Ms. Polazola? No. Mr. Rodriguez?
Yes.
Mr. Rodriguez, yes. Mr. Rivera?
Abstain.
Mr. Rivera abstain. Ms. Saunier?
Abstain.
Ms. Saunier abstain. Ms. Haley Beelan, can you continue the vote?
Ms. Tarver?
Yes.
Dr. Wilson? I have 11 yeas and 1 nay.
So we have a vote on the amended motion of 11 yeas and 1 no. So the motion passes. Thank you, ladies and gentlemen. So the next issue before us is, I believe, the ratification of the council's 5-year plan. And so as we all know, the 5-year plan, we had a committee that put that together. We brought that to a vote. It went out for public comment. We had, I believe, 3 public comments that we shared at our executive committee meeting. I don't have those directly in front of me, but they were positive comments. I recommended that the suggestions that were made by at least 2 of the commenters that we put that focus toward our 2022 plan that we have yet to develop. Because I think the 5-year plan goals and objectives do support us to be able to address those matters more directly and more quickly within our 2022 plan. But we do need to ratify the 5-year plan today so that it can go into effect and go for consideration by our federal partners as meeting our mandate for the 5-year plan goals and objectives. So do we have that to put up on the screen, Courtney, or at least a synopsis of it? Okay, so again, this went out for a 45-day period of comment after it had been talked about, discussed, and put together by a committee, and we talked about it last meeting. So it went out for the 45 days of comment. There were, I believe, 3 comments. One was in positive support of, I believe, goal number 2. 2 had to do with making sure that behaviors were addressed. And correct me if I'm wrong there, Courtney, but I believe that was the major issue with the other 2 comments. And we discussed it at executive committee, and we're certain that we can add those concerns into the 2022 plan that is yet to be developed. But we will take those recommendations into consideration there. But you see before you now the 5-year plan as we have developed it. And now we would need to approve the 5-year plan. So Courtney, do we need a motion or can we just vote? Again, I'll ask, do I need to ask for a motion or can we simply
I'm sorry,
vote?
I was having technical difficulties.
I understand, I am as well.
Ms. Learson, do we need a formal motion to ratify the council's 5-year plan, or is a unanimous consensus appropriate in this matter?
Mr. Chair, if you simply use unanimous consent, that is to say, if there is no objection to the 5-year plan, it will be adopted as displayed, and pause. If there is no objection, then it is ratified.
Okay, so we will do that. Thank you, Madam Parliamentarian. So you see before you the 5-year plan as written. Are there any objections to it? Hearing none, it would pass by unanimous consent. So I thank you all.
Mr. Rodriguez has his hand raised.
I know you were talking, but you were on mute.
Chris, you have the floor, sir.
Yeah, thanks, Randall. Just really quickly, just as a technical note, how many votes during this meeting, I guess it would depend on how many council members we have present, constitute a passage of anything? It's a majority, but what does that equal today?
I would have to check the bylaws. I believe it's 2/3, but I need to double check the bylaws, and we're about to go to lunch, so I will do that. But we've passed so far all the votes by a good majority. But I will check the bylaws to be certain of that.
Thank you.
Courtney, do you have the budget report?
Don't eat while you're on your computer.
Okay. Okay. Is
Okay,
the
so
budget report displayed? I'm not sure.
Yes, it's on the screen.
Great.
So we have the budget report before us.
Okay. So if you will recall, earlier in the meeting, I had indicated that there were several meetings with the Louisiana Department of Health and the various departments within it that pertain to budget and fiscal and planning and accounting. I'm sure Ms. Or some of the other state agencies can relate that it's not just one entity within a department where you discuss financial matters. It's several, but there was the issue, and we had talked about this last council meeting, that the operating expenses seem to be being erroneously reported in our report. So we conducted some research to find out what exactly was being charged to those accounts. And we did eventually find where some charges were being made erroneously to those expenses. So it's taking a process of doing some journal voucher entries and realigning some of the budget to make sure that we can accommodate the correct charges or the correct application of those charges. So that they have been identified, and it's in the process of being corrected. So unfortunately, before this report was created, LDH could not be reflected in this report. But it is being correct.
Okay, does anyone have questions for Courtney with regard to the budget numbers or the budget itself?
Chris Rodriguez and Karonda Corley have their hands raised.
Yes, Chris, you have the floor, sir. Chris, you have the floor.
It was just Can you hear me?
No, just now we heard you.
Yeah, sorry. There was my hand was raised from before. Sorry.
Okay, thank you, sir. So are there any questions with regard to the budget?
Rhonda has her hand raised.
Rosalind, did you say?
Miss Corley, Karonda Corley.
I'm sorry. Ms. Corley, you have the floor.
Thank you so much, Mr. Chairman. If I wanted to make sure that I heard them correct, that they said that this council budget report is not accurate. Is that what they said?
Courtney has been working
I'm
to,
trying to correct some technical difficulties. Okay, so this report was created before some of the corrections could be reflected in that. So this report is for the end of the second quarter, which was by December 30th or December 31st. So those corrections are still being processed by LDH and won't actually be reflected until this month. So because this is the second quarter for the state fiscal year budget report, that's why this report reflects that specific amount for the operating expense. Like I had indicated before, we've already identified what the errors are, and that's being changed so that for January, it will reflect accurate information. Does that answer the question?
Permission to respond, Mr. Chairman?
yes, you have permission.
Okay, that does answer the question, and I would like to strongly recommend that the actual accurate information be brought back to the council and also be provided on the website, as well as a convening of a meeting, not necessarily a full council meeting, but a convening of the executive committee, just so that information can be provided for the community to be able to see, to show transparency, as well as provide real and true accurate information. That's my strong recommendation. Thank you so much.
Noted, thank you. As soon as we have all the updated data, it will be publicly provided.
Kim Bazile also has her hand
Anybody
raised.
else have questions with regard to the budget?
Kim Bazile.
I'm sorry, Brenton, I couldn't hear you. Who?
Kim Bazile has her hand raised.
Yes, Kim, you have the floor.
Thank you. Courtney, I'd like to request when y'all do present the accurate information for us, if you could present it in the format where we see where it was originally recorded, and then the corrections that were made, debits or credits, to the ending, the correct amount. I can actually shoot you a little spreadsheet if I'm not explaining myself correctly. But I'd like to see where the corrections are being taken from and moved to.
Yes, ma'am. I believe we can accommodate that.
Thanks, Courtney.
Okay, any further questions of Courtney with regard to the budget? Hearing none, Courtney, unless you have something else to add, I believe it is time to adjourn for lunch. Is everyone in agreement for an adjournment for 1 hour for lunch?
I move that we adjourn for lunch.
Thank you, sir.
Recess. I'm sorry, Mr. Chair.
Yes.
If you don't mind, it's not to adjourn for lunch, but just to recess. If that motion can be corrected, recess.
To recess for lunch to return in 1 hour at 1 o'clock.
I apologize.
So we're having a recess for a 1 hour lunch break. And we will return for business at 1 o'clock. Everyone in agreement? Do I have unanimous consent? No objection? Okay, thank you, everybody. We'll see everyone at 1 o'clock.